Please come to order. Good morning. Welcome to the Commissioners of St. Mary's County meeting this date, Tuesday, February 9th, 2021. I am Randy Guy, President and Commissioner of St. Mary's County. I'd like to introduce the other commissioners. Standing to my right, representing the 1st Commissioner District, which includes Ridge, Piney Point, St. George Island, Mr. Eric Colvin.
Good morning.
Representing the 2nd Commissioner District, which includes Leonardtown, Hollywood, Mr. Mike Hewitt.
Good morning.
John O'Connor, who represents the 3rd Commissioner District, which includes Charlotte Hall, 7th District, Golden Beach, and Mechanicsville, is joining us via WebEx. John, you on?
Good morning.
Good morning. Sitting to my left, representing the 4th Commissioner District, which includes Lexington Park, some of California, Great Mills, and some of Hollywood, Mr. Todd Morgan. Sitting next to Commissioner Morgan is Dr. Rebecca Bridget, our County Administrator. Elisa Casas, our Communications Director, is sitting at the table to my right.
Good morning.
Amy Carter, our video media producer, is behind the glass. Please turn your cell phones off or on vibrate. At this time, we'd like to have our invocation and pledge. Please stand.
Dear Lord, thank you for this beautiful day. A little snowy out there. You can make that go away anytime you like. Other than that, thank you for the beautiful air that we breathe and the food we eat and this vaccines coming out and getting under control. I'd like you to pick the speed up on that too if you could. Thank you very much. And give us the wisdom to make the right decisions and the courage to follow through on them. All this in your name. Amen.
Amen.
Please join me in the pledge. I pledge allegiance to the flag of the United States of America and to the republic for which it stands, one nation, under God, indivisible, with liberty and justice for all.
Thank you, Commissioner Hewitt. Next, we need the approval of the consent agenda.
I move to approve the consent agenda, which includes the minutes of February 2nd, 2021 as presented.
Second.
I have a first and second. All in favor? Aye. Any opposed? Ayes have it. Next, we have a presentation, and we have a retirement commendation for Jeffrey McLean. Who has that? I got it. Got it? Okay.
Yes, please.
Yes.
Jeffrey McLean, my friend, how are you, sir?
Good morning, Commissioner. Thank you.
Well, you know, everybody's got to retire one day. The Commissioners of St. Mary's County officially commends Jeffrey McLean for 43 years of outstanding, praiseworthy, and dedicated service to St. Mary's County. Through your diligence, dedication, and relentless pursuit of excellence, you have rightfully earned the community's gratitude, respect, and admiration. We hereby express our sincere congratulations on this occasion of your retirement and extend best wishes for your future endeavors and ask God's blessing upon you. This day, February 1st, 2021, but today is February 9th, so this is the Commissioners of St. Mary's County. Now, a little bit about Deputy McLean. He was hired January 11th, 1978 as a deputy trainee with the Office of the Sheriff. He's held multiple positions. In July 1 of 2006, he converted to Armor full-time and retired from this position. Again, 43 years of service as of 3/1/2021. Thank you, sir.
Thank you. Sheriff Cameron, a few words possibly?
Sure. Commissioners, thank you for acknowledging Jeff for his exemplary career, 2 careers really, as a police officer, then as one of our trainers and our armorer. I'll say this about Jeff on a professional level. Jeff has been a staple around the Sheriff's Office. As you know, Commissioner Hewitt's been looking at him a long time.
Good man.
Not a kinder, gentler soul that there is, very supportive of everyone, always. On a personal note, Jeff has always been there. I had a biopsy done in my lung when I was a young policeman. And the only thing I remember is waking up to doctors and nurses and Jeff leaning over the table that I was on saying, "You're okay, you're okay." it's nothing. It's nothing. And I thought, wow, how in the world did Jeff get in here? It was cool. It was reassuring to see him. And really, in my entire career in my life, Jeff has always been there. So I'm so happy and proud for him and his family now to get on the road and enjoy things he's worked so hard for. But he will be missed. We'll fill his position, but we'll never replace him. So he's certainly what I refer to as a Hall of Famer. Anybody that retires and gets out unscathed with this profession is certainly a Hall of Famer. So Jeff, I thank you for your professionalism and your friendship over a long, long period of time. Thank you, Commissioner.
Jeff, the floor is all yours.
First off, I'd like to thank everyone here. Thank God for putting me in the position to be that I'm in. I've worked with some truly great people. I think Sheriff Cameron and I are the last two on the Sheriff's Office that were hired by Joseph Lee Somerville, Sheriff Somerville. And it's been a whirlwind trip. It really has. It doesn't seem like 43 years. Sometimes it seems like a lot longer. Sometimes it seems like it just started. And thank you very much for your kindness and consideration.
We appreciate everything you've done for us.
Thank you for all your help in your 43 years. That's commendable, believe me.
Thank you.
Thank you.
Gentlemen, if we can get a formal portrait, if you'll stay at the table and Sarah will get your picture. Thank you.
Just get one just in.
Okay, this moves us right into County Administrator time.
Thank you, Commissioner President Guy. Commissioners, I bring your attention to the draft agendas for February 23rd and March 2nd, as there will be no meeting of the Commissioners next week on February 19th. So for February 23rd, you begin your meeting at 9 a.m. with a public hearing for the proposed amendment to the Solar Task Force temporary moratorium on utility-scale solar projects. Then at 9:15, you have a public hearing from Land Use and Growth Management for the proposed amendment to change the critical area overlay from resource conservation area to intensely developed area for the Real Food Studio project. You have your weekly updates from the Office of the County Attorney on legislation. You adjourn your morning business meeting and reconvene at 1:30 p.m. with the Department of Finance for your budget work session. The next week is March 2nd, 9 a.m. You begin with your public hearing for the proposed amendment to the official zoning maps of St. Mary's County to delete the existing 1,000-foot critical area boundary line and replace with the new critical area boundary line from the statewide base map as required by House Bill 1253. You have two proclamations scheduled that morning, National Disabilities Month and Women's History Month. You have your weekly update from the Office of County Attorney on legislation. You adjourn your business morning meeting, reconvene at 1:30 p.m. with the Department of Finance for your budget work session. For this morning's business meeting, you begin with item 3B from the St. Mary's County Library with their semi-annual briefing. Michael Blackwell, Director of St. Mary's County Library, presenting this morning, and he'll introduce any guests on WebEx. Good morning.
Morning, Mr. Blackwell.
Good morning. Get my Denny's placemat set here. I'll have a double slam breakfast, please.
Yeah, we need some crowns
Sorry,
up there for you to
couldn't
color
resist.
with.
Yes, thank you so much for the opportunity to be here this morning. And I'm trying to see. Oh, okay. Most of our board have not been able to join me this morning. But thank you so much for the opportunity to present to you on library operations, pretty much just since 6 months ago when I last presented to you. And I sent you a more detailed document, which is available on Board Docs, I believe. And that has, for the public who might wish to access that, among other things, a link to a lot of our virtual programming. So you can see many of the things that we've done, and that some of which I'll be talking about I can only touch upon some highlights today. Obviously, the big story for us, just like everybody else, has been the COVID-19 pandemic. When I last reported to you, we were doing curbside and virtual programming, and we had just on August 3rd opened the library for in-person visits. And we continued that for quite some time. I told you then that we're only the third library in Maryland to open its buildings, and we looked at national studies to try to get guidelines about how to quarantine materials best. We've maintained our social distancing and our PP use. Basically, we've tried to really walk a tightrope between being open as much as we can and giving as much in-person service as we can, and trying to make sure that we're a safe place for the public to be and not a place where the pandemic might be spreading. Basically, many libraries have still not opened their doors to the public. Charles County, for example, has never done so. They've only got curbside service. I'm not trying to criticize them. Everybody needs to make their own decisions based upon what's happening in their own county. I just want to say that I think we've been careful but very bold. The two libraries that opened before us, in fact, subsequently closed their buildings to the public. So right now, St. Mary's is the library which has been open to the public the longest of any in Maryland. We did last fall, at the same time that you and the county closed your buildings and made them by appointment only, made our libraries by appointment only as well, but we kept them open for computer use of many people in the county, as you know, and I know you're working really diligently to expand broadband here, but don't have broadband access, so we just view that as an essential service. Working with Bob Kelly, furthermore, and thank you for that work, Mr. Kelly, we've extended our Wi-Fi throughout all our parking lots. So you can pull up there anywhere in the parking lot, get Wi-Fi access. It's on 24/7. In more clement weather, especially in the fall, what we were seeing was a lot of students who didn't yet have access come, sit out there, connect. So we've been a source for, community hotspots as well. People can check those out of the library, and if you don't have one, please come to the library and we'll hook you up. We have unfortunately had one employee test positive for the COVID virus. To my knowledge, however, we have had no in-building transmissions. That was a case of somebody picking up because of his home situation. So I think we've been safe. You'll be glad to know that that employee is recovering slowly, but I think very well. We do have plans now for restoring more full service and moving away from the appointment only. I'll be talking about that in just a couple of minutes. An update on the new Leonardtown Library. Its total and absolute completion has been delayed somewhat by the pandemic. Getting contractors to come finish a couple things has been a challenge, but really only very small projects remain. As you may be aware, unfortunately, there have been some trouble with the plumbing there, but we're looking to have it ship-shape and ready to go as soon as we possibly can. And I just love to completely throw the doors open wide on what I think is going to be the busiest library in Southern Maryland. Can't wait for this pandemic to be over and just have everybody come and see how wonderful it is without any restrictions at all. Now, typically in a presentation like this, I talk to you about how busy we are, about our programming numbers, our user visits, how many materials we circulate. Obviously, the pandemic has put something of a damper on that. But I do have one positive thing to report, and that is that our digital content use, ebooks, digital audio books, digital music, digital movies, is up 40% over last year at this time. So a lot of people are discovering that we do have a wealth of information available that way. And if you haven't yet checked out what the library has in that, please go online or call us up and we'll talk you through the whole process of doing that. We have made steps to try to increase our digital offerings as well. So there's more content there for people in St. Mary's. Speaking of digital content, I want to talk to you about two initiatives where St. Mary's County Library is literally a national leader. And the first is that we arranged to digitize 4 print books that are of local interest, including In Relentless Pursuit of an Education, which is a book put out by the Unified Committee for African American Contributions about the Drayden School. And that's not so unusual in itself, but the step we took through a grant, working with an organization called the Digital Public Library of America, is to make that available in the same place that all our commercially available titles are available. So if you go into our app, you'll be able to find that local content there. It's really great local history, and basically, so if you go looking for a bestseller, say a John Grisham, you can also find that local content there. And that's not something that any other library in the country has done yet. And we were a pilot. The Digital Public Library of America has now made that a national initiative that libraries across the country can do. And the second is that we are a driving force behind a bill that's currently before the Maryland legislation about digital content. Basically, there's a lot of digital publishers, and Amazon is perhaps the primary, I'm going to call it, offender here. They have a wealth of money. They've got their own publishing house. Increasingly, they're getting exclusive contracts with authors. And you cannot get that material any other way than by going to Amazon and plunking down your credit card. And we in libraries don't think you should have to have a credit card to be an informed Maryland resident. So what that legislation does is that it says that anybody who makes a book available to the public in Maryland also has to make it available to libraries. I testified about that last week, testifying before the Senate on Thursday, and that came from an initiative I did where basically we had Senator King submit an opinion to the Maryland Attorney General and say, is that practice even constitutional or legal? And this bill came about as a result of that. Maryland would be the first state in the country to offer that protection to its readers, and I think that this will be a template that other states are going to follow.
How does that tie to the digital advertising bill?
This is a separate bill completely. It was Senate Bill 432 and House Bill 518, so there's no connection to that particular bill.
Thank you.
This is completely separate, and all it does is just address that one issue, not anything related to advertising. Well, as long as we're talking about going digital, let's talk about that In Relentless Pursuit of Education. That was part of a program we did called Community Conversations on Race, where we partnered with the UCAC, with St. Mary's NAACP, with St. Mary's County Museum Division, and with Historic Sotterly. And we provided programming, among other things, that did a virtual tour of the Drayden School and the old jailhouse in Leonardtown here. We had a teen book discussion. We had a session where the community could discuss that book, having made it available digitally. And so people who attended the Drayden School came and talked about their experiences, and we had teens talk about their current experiences in education here, and just talked about the progress that's been made and some of the challenges that might still remain. Some other programming highlights: our digital art programs have proved very popular indeed. Often we've had over 100 people online learning how to do, for example, watercolors. And kind of what we're finding out is that there's a sweet spot for some programs. We're probably never going to be able to go back to doing them in person because they're so popular digitally. So maybe we'll have an in-person, but then also a virtual component on something like that. We've had virtual crafts classes. We've got training classes for those who are new to various social media platforms, such as how to use Facebook for people not familiar with something like that. Training classes on how to use the library's apps and get that digital content. Pint-sized playtime is activities for parents to do with their children to teach colors, shapes, letters, and numbers. We've had make and take crafts, and that document that I provided for you has some photos of some of those. Basically, they swing by, you can pick them up at the library, the parents can go home, do the crafts with their kids. We had a really fun program where a local piano teacher was working with her students, and we broadcast their spring piano recital, their summer hymn sing, and their Christmas recital, so their relatives could see that virtually. We've had people from as far away as Israel email us and say, thanks for that. It allowed me to see somebody that, something I really wanted to see. We've had popular games for teens. One of them's called Among Us. It's a social game involving deductive skills. And you got to figure out who the so-called villain sitting hidden in the group is. We had a Holocaust Museum program where a research historian from that institution talked about its mission, the importance of its history, and of remembering history, and chilling examples of that time of propaganda and censorship. We've got book discussions for teens, for adults. So we've kept on working virtually, even though we haven't been able to have as much in person. Some notable activities right now, we are partnering with the health department. We are helping field phone calls about getting the coronavirus vaccination. We're averaging about 45 calls a day. On Friday, when signups occur, people can use our computers to sign in and actually sign up to get their vaccination. We've got a new library app. Again, that came through a grant that allows people to do virtual checkouts. So you walk into the library, you've got your books, get out your cell phone, your tablet, and you can check them out yourself, and that way you don't have to handle our self-checkout machines or hand books over and get books back in order to check them out. We've got a really popular thing going called grab bags. So you can say, I can't go in the library right now, but I really love mysteries, and I particularly like this author. You call us up, you say, I want 15 books that are like that, and we'll check them out on your card, put them in a bag, you take them, and you go, and so you're ready to go. We do that with DVDs as well. In partnership with the Mothers Club up in Charlotte Hall, we've opened that little free pantry again to try to help provide food during the ongoing challenges, economic challenges here. Our 3D printers ran almost nonstop, making ear sabers and headbands to make PPE easier to wear. We were working with the good folks there at the PAX Museum as part of that initiative and made literally thousands of those. A couple of things that are coming up. Starting on February 26th, people will be able to get a unique code from the library to view a film called Black Men in White Coats. It's part of our African American presentations for the month. There are fewer black men applying to go to medical school now than did in 1967. And this film explores the whys of that. And so we are having a panel discussion. Mr. Kelsey Bush will be the moderator for that, and we're trying to get some local folks from the medical community to talk about that. So there'll be 5 days where up to 2,000 people can view that movie, and we're partnering with the schools on that, with Historic Sauterley, with UCAC and NAACP, and with the folks from Dismantling Racism. So we think we'll probably get all 2,000 views going on that. And then people will be able to log in, have the panel discussion, ask online questions. That's coming up. Look on your library website and you can get your own code for viewing that. Talk a little bit about our reopening plans. We are targeting March 8, so about a month from now. By then, we think that with any luck, the pandemic cases are going to slow enough that we're going to go back to opening our buildings. Now, we will limit the number of people in them at any one time, but it will no longer be necessary to have an appointment. Come right on in, use your library, and I'd say my staff is nervous but determined and very excited about getting back to that again. What library service looks like after that is going to be very interesting. I don't know how quickly the public's going to want to come out again in the way they once did. I'm sure people are still going to want to be careful. You will have to have, a mask. We will, have social distancing going on. Try to be careful about that. Maintain our cleaning schedule. Use some of these wands when we can, although that's pretty much impossible to do with a public car because you're not supposed to look at the little square of light that's disinfecting the surface. And of course, the first thing what happens when you say, now don't look at that, is someone's going to look at that. So, we know we're going to have to be more digital capable and offer even more digital resources. So we'll be looking to do that. At the same time, there's still the digital divide. There's still people who love print books as opposed to digital. So we're going to have to do our best to get back to some of the traditional things while we have even more digital programming, more digital resources. We do have 6 programs coming up for children that will be outside, so we're looking to get back to some actual face-to-face programming. Again, social distancing and outside should make that safe for everybody. At long last then, I hope eventually we'll open wide that new library. And for right now, I'd just like to say thank you for all your support of libraries and for all that you've done to help, us do a great service for St. Mary's County. And if you have any questions, I'm happy to field those.
So you said March 8th will be a full library opening, or are you going to do partial? Or, I mean, we get a lot of people complaining to us about the lack of accessibility or don't have an appointment or something, so I'm trying to figure out
Sure,
what
yeah. All right,
March
so
8th means.
what's going to happen is we're going to be open the same hours we are right now, which is Monday through Thursday from 1 to 6, Friday and Saturday noon to 5. But you'll just be able to walk right into the library, walk through the stacks. We will probably not be opening the meeting rooms just yet because it's pretty difficult to do social distancing or at least sort of watch over that. But I hope before the summer's end that we'll have our meeting rooms open as well. And then we'll also extend back to our full hours.
Okay.
But on March 8th, that's my target for having the libraries be, once again, walk-in. And I'm getting those phone calls too, as you can well imagine. I know the schools are going to be opening, I believe it's March 1st, and we don't want to be far behind them in any case. So it's, I think it's time. I'm sorry we had to close it all, but, with the resurgence of that pandemic, when the county itself closed its doors except for appointments, we thought it was the safest thing to do. But, I'd say that we have been, by library standards, at least very bold about this and maintain being open. And I'm just delighted that we're going to be able to do that again.
Thank you.
More questions?
Will you have any capacity limits when you open on the 8th?
Yeah, we're probably going to have, they're fairly high. It will probably be the same as they were last fall, probably no more than 24 people in our larger buildings, no more than 12 in our smaller ones. We weren't finding that was a challenge for most people. We weren't turning people away.
Okay, good.
And we could perhaps push it. What we did is we looked at the square footage and divided it by 100 and I think it was, I might not remember the figure exactly, it's like 152 because that's the square footage of a 14 square foot diameter. So we got a person and then 6 feet all around them. And we divided it and said, all right, we can have that many and guarantee social distancing. There was some science here. I think we can probably get more. And if we start to see that we're turning people away, we'll certainly be exploring the option of raising those limits.
So
Everybody wearing masks and the whole 9 yards, right?
Yeah, we will continue to have mask wearing be required, and we will ask people to physical distance. It's difficult for us because often when people come in to use our computers, they're not experienced computer users, and they want us standing right next to them.
Right.
And we tried for a while
Have a pointer?
having a laser pointer and said, if you use the right color laser pointer, it'll work on a computer monitor. Now look there, and it's just not working. So, our staff are right there with folks, so we really do want to have that mask use in place.
Sure, absolutely.
What, if you do the restaurant rule, 50% capacity, are you using your 24 based upon your 14?
Yeah,
square
it's
feet?
based on that.
It's not
If
based
we
upon-
did it at 50% capacity, we could probably have in any one area of the library, of one of our larger libraries, we could probably have 75. I'd have to go look at what the fire code limits are. I know as you walk into the New Leonardtown Library, the capacity is 1,382. Well, that's for the whole facility, including the senior side. So take away the lobby and everything like that, we can probably go up to 75 people safely, I'd say.
So 75 would be 50%?
I'm going to say roughly about that, yeah.
And you're going to 24?
I'm sorry?
And you want to go to 24?
To start with, as I say, that if we're finding out that in the fall, when that was the limit we had, we weren't turning people away. But if we start to see that it's getting more popular and we're turning people away, we'll probably expand that, yes.
Thank you.
We'd like to continue serving the county as much as we possibly can.
Are you getting any state guidance on this, or is this all, you're working this out?
Well, I was part of a committee when the pandemic restrictions first came, where we looked at it statewide. There's actually some national guidelines about library materials done by Battelle. You're probably familiar with the name, a nonprofit out of Columbus. They own the patent on, for example, whiteout, do a lot of research. And they've looked at how long the virus can live on different surfaces in a library or different library materials. So we're quarantining with those guidelines in mind. But I would say that, yes, we looked at it statewide. We're, I think, a little bit more aggressive on the open than some libraries, but then, a place like Montgomery County or Prince George's may have had a far worse time with the pandemic than we have, unfortunately for them, unfortunately for us.
So, Mr. Blackwell, I know a lot of county buildings have put HEPA filters in. Are you doing anything like that in the libraries? I think that can really help with keeping the air safe.
Yes, I owe a huge thanks to our health department. As part of their CARES grant, we got about 120 of the portable air filter units. So in individual offices, we have them. In workspaces, we have them. And currently, they're spread in the library around the computer areas.
Good.
So we know that the HVA system, even in the new library, wouldn't have the capacity to filter out COVID germs, but those air filters are helping us a lot. And we really want it to be as safe as we possibly can. And again, thank you to the health department for their work, and also as part of their CARES grant, providing us with some personal protective equipment for a 6-month supply, in fact.
Thank you. Anybody else? Commissioners, anything else? Mr. Blackwell, thank you very much for your presentation, and I would say definitely continue on with your digital platform, because this may extend. I mean, it's optimistic you want to be open the 8th for personal, but in the future, this digital thing's going to be.
It's not going away. The pandemic has been an accelerant. Something that we knew was going to happen is just happening faster
than we expected. Yeah, you're right. Exactly right. Thank you very much.
Well, thank you so much, and again, for your support of libraries. And at some point, I know we've got a wonderful virtual ribbon cutting from the new library. At some point, I'm hoping when the senior side can open that we can go back to having a real ribbon cutting sometime.
That would be good.
Yeah.
That would be good.
Thank you so much.
Thank you very much.
Thank you, Commissioners. And just to bring your attention, Dr. Brewster, the health officer, has arrived early. So would you like to go out of order and move to your Board of Health section?
I think it's a good idea.
Good idea.
So you can go give more shots.
We don't want to take away from the shots too much.
All right,
Thank
I
you
move
very
to
much.
adjourn as Commissioners of St. Mary's County and reconvene as the St. Mary's County Board of Health.
Second.
I have a first, second, all in favor? Aye.
Aye.
Ayes have it. Good morning, Dr. Brewster.
Good morning, good morning, Commissioners. How are you all?
I had no effect on my second shot.
Good.
I feel fine.
Me neither.
A little bit
Fantastic.
of sores, that was it.
Old people were just hanging in there.
Old people hanging in there.
Well, I'm getting my second one.
Yes, you are. You're scheduled, right?
Yep.
Okay, good. Good to hear. Excellent. Thank
But there's a
you.
lot of people who want to get one, and they're kind of, so I'm sure you help us out.
Yeah. Well, as I've been communicating with you all, our limiting factor is the allocation of vaccine doses from the state. So we're eager to see more vaccine coming to St. Mary's County, ultimately. All right, I'll go ahead and start. Thank you. I actually have a few slides, and then we'll link over to our data page as well, as usual, just to give you an update on what's going on with COVID. So again, as usual, I'll focus on describing kind of where we are in terms of the data for COVID and the pandemic, as well as a few new items that we've rolled out for our community. So if we go over, please, to the next slide, and if you want to click on that link, That would take you to the COVID-19 data dashboard held on our St. Mary's County Health Department website.
Just a second.
As that's being pulled up, just so you're aware, we've tested for COVID-19 43% of our St. Mary's County population at least once.
I'm sorry, what was that, 43%?
43% at least once
Have been
Tested
have
for
been
COVID.
tested for COVID.
tested?
Mhm,
Okay.
Since we started. As of yesterday, we've had 5,475, right here, thank you, 5,475 cases of COVID-19 in St. Mary's County residents. We do appear to be emerging from the post-holiday surge that we were experiencing after the Christmas and New Year's holidays. The weekly number of cases, if you scroll down, please. Keep going. To here, yep. The weekly number of cases, as you can see, for the past handful of weeks has declined every week over the past month. This is a very encouraging trend. I do want to point out, we are still in the surge. If you look at where we are now, it is still very high compared to any time in the beginning of this pandemic or throughout this pandemic. So we are still in a surge. This is not the time to loosen up on our efforts, but it is encouraging, the trend that we've been seeing the past few weeks.
Now, would you expect to see a Super Bowl surge or?
Possibly.
especially
That's
variants that are
something we'll
here?
be certainly, hopefully, people were mindful that we were in a surge and didn't gather for Super Bowl parties and so forth, but certainly that's something we're concerned about and we continue to be concerned about, and we'll have to see, usually we'll see an impact 2-3 weeks after period of time. So we'll be monitoring very closely, of course, in the next few weeks to see what happens.
What's our R1 rate?
So we'll get to that in a moment. It's
you.
above 1 at this point in time, the R2. For the past week, we have also had our new case rate less than 30. So that is a first for a very long time that we've been able to sustain a new case rate less than 30 per 100,000. Hospitalizations, if we trend down, please. Sorry, this is the new case rate. You can actually scroll that bottom over, the bottom gray bar. Yep, if you scroll that over, that takes you to what's more current. So you can see our new case rates have been declining. And as I mentioned, this past week or so, we've seen rate numbers less than 30. This is consistent also with the decline in the new case rate statewide as well that we've been seeing the past couple weeks. You could scroll down, please. Keep going down. This is what Commissioner Morgan was asking about, the RT. If you take that bottom bar and scroll it over to be more current, and you can see RT fluctuates quite a bit. Again, this is an estimate. Sometimes the RT is a couple days behind as what the current values are, but it is, of course, concerning when we look at estimates even with an RT that's greater than 1.
Yeah, okay, so I look at the RT, and we know the magic number is 1, per se.
Sure.
And we see that rate rising, and we go back a couple charts, and we see that rate decreasing. Is there a correlation?
Which charts are you talking about?
Okay, so we
Which
have the RT rate going up to whatever. Now, if we
Okay,
go-
with
we
the
go
new
back
case
up
rate
to
decreasing and so forth?
Right there, the new cases per.
Sure. So the RT takes into account a variety of factors. That's why it's an estimate, it's a model.
Okay.
This model in particular that we use has been known to slightly underestimate what the RT value likely is in terms of spread of infection.
Okay.
And so that's why we have a second RT model that we're following. We're working with our data contractors to try to get that graph up on this image as well.
Okay,
That
thank-
usually is, depending on how widespread the community spread is, that might impact the accuracy of, it's an estimate, right? So it might impact how good of an estimate the RT model is.
Okay, thank you.
Thank you. If you could go down to the hospitalizations. I believe that's it right there. And if you could, please scroll over to current. So, hospitalizations are relatively high for St. Mary's County residents. And again, this is reflecting hospitalizations in non-federal facilities. This is not including VA hospital stays throughout the region for St. Mary's County residents. So we are seeing, we're still concerned about these high burdens of hospitalizations. They have dipped down a little bit compared to what we saw in December when we were really peaking in our hospitalizations, but not, certainly still very high compared to where we've been throughout most of the pandemic. If you could scroll down, please. And our outcomes. Certainly, I'm very concerned. We're continuing to see new fatalities related to COVID in St. Mary's County residents. We've now sustained 108 fatalities in St. Mary's County residents in less than the 12 months of that we've been having this pandemic.
Dr. Brewster, has that been broken down by age at all?
We don't have it broken down by age here. Oh, actually, sorry, there is a graph underneath that breaks it down by age category. We can scroll down to that. Right there. So that's the distribution of breaking down. And as you see, we're still mostly concerned about the 70 and older population, but we have seen a rising number of fatalities, especially in recent weeks, related to that less than 70 age group.
What's the total, 70 and over?
Less than 70 is 9.
99.
108 total for St. Mary's County
So
residents.
less than 79.
Yep.
But over 70 is 99. So you're in the zone, Bubba.
I'm in trouble.
Well, tell me, what about our Charlotte Hall, our nursing homes? Where are we?
Great question. So
Is
if you
that
scroll
next?
down, yeah. If you scroll down,
ahead of you.
here's the long-term facility data. We still have active outbreaks in Charlotte Hall Veterans Home and St. Mary's Nursing Home. The Chesapeake Shores outbreak is now closed. So this is actually just
Okay, help me
tracking
with
the number of cases.
blue and the green, I probably should know.
That's okay. Residents are the number of, they're the number of total
I
cases
got
since the
you.
beginning of the pandemic.
Our residents and staff.
Sure.
Got
This
it.
is not necessarily an indication of current active cases. This is the total number of cases those facilities
You've
have
had that many
constituted.
staff get infected?
Yeah.
Wow.
Well, if you think of it, staff are the ones that are going in and out of the facilities, right? They live in communities, and if community spread is high, then they're more likely to get infected in their communities and bring it into
I
the
guess where I go with that, I'm sorry to interrupt you, is
Okay,
that,
go
we
ahead.
talk about continuity of government, how it's somehow important for, politicians to get, but these people here,
Well, they were part of Phase 1A.
I hope
They were the
so.
first ones on deck,
Lord
really.
knows, look at those high numbers for them, though.
Sure, absolutely. And actually, most of our nursing homes have received their
Those are
second
people a
doses
whole lot more
already.
important than we are, I'll tell you that.
That's why we had them in Phase 1A, sir. Yes,
Okay.
exactly. I mean, I agree. I think the long-term care facilities and their residents and their staff were the first kind of critical population we wanted to get vaccinated. And they were. They were the first critical population, along with the hospital workers, who started receiving vaccine across the country. And
So the Veterans Home has all been vaccinated now?
they've had, yes, so there's 3 visits. So this is all through the National Federal Pharmacy Partnership. They're the ones responsible for vaccinating the staff and residents at our nursing homes, at our, long-term care facilities in the country,
Okay.
for the states that have agreed to that. So most of these facilities have received already their second doses, and when they go back to give second doses, they also offer first doses for people who declined the first time around. So
Good.
there are some people who are still waiting on their second dose because they may have delayed receiving their first dose.
But I want to make sure that everybody's clear that if you've had your first shot, the second shot is there, and you shouldn't be concerned that you're not going to get your second. Is that a fair statement?
Yeah, so this is what we've been advised from the state, and so we do trust that that's going to happen, and we haven't seen any indication thus far in our county that this is not going to happen. So
Thank you.
we have, at this point in time, for the people who are due their second doses, this week and next week, we have the second dose supply.
Okay.
Now, every week, just like we get first doses from the state, we get second dose allocation from the state as well. As I said, thus far, we haven't had our second dose allocation for St. Mary's compromised. We are always concerned about that, of course, and we want to keep an eye on that. But our priority is to make sure to get those second doses into the people whose arms need it.
Dr. Brewster, and you're probably going to cover this, so I apologize if
It's
you are.
okay.
But to see 99 out of 108 cases of the deaths be 70 and older, we've heard from people who are 70 and older, and they still haven't been able to get a vaccine.
Yeah.
And one gentleman's suggestion is when you roll out new doses, maybe you give the people who are 70 and older or 75, whatever the metric, seems like 70 should be the metric from what we're looking at, an opportunity to get those doses first. Because I know we've opened up 1C, thank you very much, that fits my category, but it's not about me. It's about people needing it, and we're hearing so much from people saying, hey, look, I can't get on, I can't register, I'm over 70. I talked with one gentleman, he's trying to get his mother, she's 83, and they haven't had any success with that. Now, I have been turning people over to the county administrator, and that's been helpful for these people, thank God. But, again, if we had a system where, okay, we've got X amount of dosage, and it opens at 5, but if you're 70 and older, you can dial in at 4:30 or so. I don't know, some way of giving them a little bit extra leg up.
I'll talk about numbers in a moment, so you
Okay,
can
well
see
then
how
I'm
many
sorry, I got
of
ahead
each
of myself.
population we've done, and also what the demand is. We have about 15,000 residents in this county that are 65 and older. So that's quite a bit of residents. And if you look at the number of vaccine doses we're allocated, even if we did 100% of our vaccine doses for that population, we would not meet the demand just based on population numbers.
Well, I'd still give my dose up to somebody who's over 70, especially seeing these numbers.
Sure, understood. And I'll talk more about that later when we get into the
Thank you,
vaccine
Commissioner.
part. Because there are, we also have to consider our healthcare system and the needs of caring for all those residents as well for their other medical needs.
Oh, no,
and how
listen,
we need
you
to
got the
maintain
priority.
certain.
I'm just talking about the general public.
Sure.
They've rolled out 65 and older, and I remember that when we got, I think it was last week, they said at least 30% of that population had been vaccinated. And they talked about this 75 and older, and over 46% of that population had been vaccinated. But again, we keep hearing from people
Who
hey,
haven't been.
I'm in that older population, and they still haven't got me, and every
Yep,
time I
agreed.
try to get on, I can't get an appointment.
Sure, agreed. And I'll talk more about that when we
All right,
talk
thank
about
you.
phases. Thanks for raising that. Okay, and then just if we can scroll down to the vaccinations data that we have published, I'll share some more detailed information in a moment. And just so the public is aware, we're actually working with our website contractor to get more vaccine data related to our local efforts posted here on the website. So hopefully we'll be able to roll that out within the next week or so. This is a ray of hope. Nearly 14,000 St. Mary's County residents now have on board 1 dose of vaccine. We want to get them double dosed, of course, at least with these vaccines, and we do. I'll be talking about second dose numbers in a moment. But the health department partnership, because it truly is the community that's come together to make our effort happen, has administered over 11,000 of those first doses. So it's a pretty tremendous effort by all the partners involved to administer those health department allocated vaccines.
So, Doctor, is it fair to say the 2,700 differentials at the hospital?
Actually, and I misspoke. So the individuals vaccinated represent St. Mary's County residents. So that includes all partners who are giving vaccine to St. Mary's County residents.
So the base,
Would
too.
they
The
be
base,
out
the
of
hospital.
town, or, I
Yeah,
mean-
the base, the hospital, the nursing homes, Federal Pharmacy Partnership, any private retailers that are now offering vaccine, the health department. The second number is what's administered through the health department. Not all those doses are going into St. Mary's County resident arms, because by policy decision, which most counties have been doing, we are vaccinating anybody who works in St. Mary's County that are in those eligible occupational categories because they are here in our community. They are contributing to potentially the spread of COVID-19 in our community. And we want to make sure that they are protected so that it then increases the protection of our whole community as well. So not all those 11,000 are St. Mary's County residents. So you can't just subtract that number from the top number.
So if it was a police officer from Prince George's or DC, that counts in the number?
If they live here,
Yeah, you
and they,
said that.
Right. If they live here, yet they are an occupational category in another county, we will vaccinate them. If they don't live here, yet they work here in this county as one of those eligible occupations, we will vaccinate them.
Okay.
Understand? Yeah.
Great, thank you. If we could just move over to the next slide then, please, the slide set. Thank you. So we're not going to click on this link, but for the public to know, again, just as a reminder, this is the vaccine webpage. This is also the webpage where we post all of the appointment links when we have the clinics made with new appointments that are available for vaccine. Of note, we did publish out a frequently asked questions document that we're updating as new questions keep arising about vaccine and the process and so forth. So I really encourage residents who have questions to review that first. They will likely find many of their questions answered just with that page. Additionally, we also have updated our guidance for residents who have significant allergies or allergies to various things, so they know what to do about decisions on getting vaccine and whether or not they should get a vaccine through our drive-through mass vaccine site that we're operating right now. If you could go to the next slide. So Commissioner Hewitt, just to start addressing the topic that you raised. So Maryland as a state has decided to move into Phase 1C. And so we have to locally follow suit, although we have some local discretion on how we then implement within that phase. So as a state, Maryland decided to go ahead and open it up to 65 and older. I don't know that we had the vaccine supply to really address the needs of the 65 and older population, but that is also why we here locally have opened up our population to 65 and older. The recommendation nationally is not to wait until you have 100% of your age-eligible category vaccinated before you move to the next or open it up to the next age-eligible category.
I'm sorry to interrupt you again, but I could see that. I mean, that makes sense. But there's so many who want it. Now, those who don't want it, well, just wait until everybody who
Right.
wants it's over with and then
Agreed.
circle back to you.
Understood.
But just hear from so many who want it and can't get it.
Because we just don't have vaccine supply. And unfortunately, we want people, fortunately, we have people who want the vaccine. That's a great thing.
Yes.
And that's really positive that our residents want to get vaccinated. Unfortunately, we don't have the vaccine supply to meet that demand. So Maryland is in Phase 1C. Here in St. Mary's County, we paused on rolling out the occupational groups of Phase 1C, as I'll talk about on the next slide, in order to accommodate and better accommodate the demand in that 65 and older population that we have here in the county. So again, in order to be eligible right now for vaccine administered through the health department, you would be 65 and older and a St. Mary's County resident. You could be 16 and older if you have a developmental or cognitive disability. And for that, we ask people bring with them medical documentation or a note from their healthcare provider that confirms their eligibility based on this category. Or you could be 16 and older with some kind of immune compromised condition, and I've listed below the ones that qualify, and you are receiving hospital-based treatment. And for those individuals, they are being asked to go statewide, they're being asked to seek vaccine through their hospital provider. So the hospitals are then responsible for this particular category of individuals who are receiving hospital-based treatment. Thank you.
On this, one second,
Sure.
on this general population, you're using the list off of the Age and Human Services Department also?
I'm sorry?
These people who need these shots, the elderly people?
Yes, so
You're calling the Age and Human Services, you're depleting their list also.
yes, we're working through that as best as we can based on the vaccine supply we have. So Department of Aging and Human Services has been a phenomenal partner in this whole effort to make sure that these vaccine appointments are accessible to our local seniors, particularly those who don't have computers or aren't able to, or don't feel comfortable with the electronic registration system that the state requires.
I've been
we
telling
use.
people my age group anyway who asked me about, they couldn't get through to you. I said, call up 301-475-4200. 1049 and get on their list.
Yeah, it gets on a callback list. It's not a waiting list, it
I
is a
understand.
callback list.
Very good, very
Yes.
good.
But we do, that does allow them to better target and assist individuals who are 65 and older who've been wanting and when waiting for a
Great.
vaccine, but have trouble getting onto the computer or the electronic system to register. So if you go to the next one. So the occupational groups, 1A and 1B, as we've talked about, there's a variety of occupations. These are based on state guidance as to what is eligible in 1A and 1B, and also that state guidance reflects national guidance as well. And the occupational groups, while you look at mortality, right, and mortality is swayed towards 70 and older, although we certainly see individuals in their 60s as well who've passed related to COVID. But while the mortality is there in the older age groups, we do see a lot of hospital burden and heavy illness and long-term COVID complications from different age groups, all different kinds of age groups. So we are concerned about that as well, not just the mortality. And the occupational groups, the consideration for the occupational groups has a lot to do with how do we maintain kind of these critical emergency infrastructure supports in our county or in our jurisdictions while we're dealing with the burden of COVID as a pandemic.
Are the hospitals using all of their vaccines, or
Yes.
so there's nobody that's got some and not
So
using?
different hospital systems and hospitals vary in terms of the percentages of the vaccine that they administer. So the way the state does it, because the state distributes allocation weekly, in the beginning of the week or whenever the vaccine is received, it looks like people have low percentages of using up their first doses. Well, because they just got their vaccine doses for that week.
Right.
And so it takes them a few days to then implement and get those vaccines into arms.
Do the No, go ahead.
Go ahead. I was just going to say, so a lot of the hospitals are doing really well at getting their first dose vaccine supply into arms pretty quickly. There are some that have vaccine that they haven't administered, just like there's some in the retail setting and so forth. Across the state, the local health departments are probably the most efficient mechanism of getting vaccines into arms. There have been, several, at least a couple handfuls of health departments that have surpassed that 100% mark of those first doses within a week of receiving that supply. And many others are at that 90-plus range.
What protocol do the hospitals follow?
Dr. Brewster.
Yes, sir. Sorry, Commissioner Hewitt and then Commissioner O'Connor. Is that right? Okay.
All right.
Whichever one.
One of the things I want to point out though is the data, like you just said, and I think I'll put it a little bit more pointed, is that the state is not being accurate in their representation as to how they are showing the actual usage. So they're showing a detriment to these counties. However, what's going on is they're only partially collecting the data based on a time frame that they've never actually met in the first place. So they have a different window that closes. They were not getting phone calls on Thursdays. We're getting phone calls on Saturdays. So, fortunately for us, St. Mary's County is very efficient. And by the time the state's window closes, we're getting our data to the state. And the other counties aren't. But I think the other portion that we need to look at here is everybody talks about phase 1A, 2B, and, the 70 and older population and people wanting to get the vaccinations. But the public doesn't realize the partnership that was put into place for the county. And, we did agree to do Part B of the Federal Pharmacy Partnership Facilities, assisted living, senior living centers, DDA group homes, other high-risk congregate settings that were taking way too long in other settings to do. And it's because of the Federal Pharmacy Partnership that was going way too slow with their Part A in the nursing homes. So we agreed to do that, which also takes away from some of the vaccines that may go out to the general population. However, the state at one point was saying, okay, you're doing this, we're going to give you more vaccine because you are partnering in this program. And now us getting the minimum is going to make it even harder for everybody to get vaccinated. So I just wanted to make sure it was clear that there's other programs that are going on that are taking up some of the vaccine in the county. even assisted living. I know you were out there the other day and you administered 200 doses to make sure that people had their vaccinations, and you went directly out to them. So, based on our allotments, it's making it harder and harder and harder for that 70-plus group to go ahead and get their shots when the state's allocating less to us. And like you said, the local health departments are the most efficient in getting the shots into the arms. So I just wanted to make sure that was stated, that we are doing that, so it's not just the 1A, B, C, and D, and the other priority groups as well.
Right. Thank you, Commissioner. And you're correct. St. Mary's County, because we were frustrated with the slowness of the National Federal Pharmacy Partnership and their vaccination of the nursing homes, we decided to move forward with Part B of that partnership rather than wait months for them to get to Part B, and go ahead and start vaccinating our senior living centers, our assisted living facilities, and our DDA group homes. But we do that with the supply that we get, the weekly supply that we get from state. We were assured from state that we would get additional supply to cover that, and we're waiting on that. Commissioner Hewitt, you had a question.
Yes, Dr.
And the other misconception is the hospital. The other misconception, and this will be my last comment in this because I know there's a delay. The other misconception is that there's an unlimited supply at MedStar St. Mary's and our hospital providers. And meanwhile, the way that's divvied out is to Big MedStar, and then Big MedStar finds out where it needs to go from there. So the corporate partners and the hospitals, they're looking at it from their strategic point as well. I guess I make that point to say that while the hospitals are efficient, I just don't believe that there's anything more efficient than putting it in the hands of the local health department and making sure that we're getting it to the right people, like the 70-plus group, like Commissioner Hewitt and Commissioner Guy, and the rest of the commissioners are, quite frankly, saying, why can't we just get them vaccinated?
Mm-hmm. Yeah.
Okay.
Commissioner Hewitt?
Tell me about the hospitals again. Are they doing the same protocols, the 1A, 1B?
So the hospital's focus for their vaccine are hospital employees. So that was the focus for the hospitals.
So they don't do any patients?
So their focus is hospital employees, yes. It's mostly staff. Now, recently, the state Secretary of Health has asked the hospitals to take care of those immune-compromised individuals that are getting hospital-based care that were on that prior slide that I described. So now that's a new addition for who they can address with their vaccine supply. But their vaccine supply is intended for hospital-associated staff. Now, here at MedStar St. Mary's Hospital, they've been a fabulous partner. They did a great job early on in getting their centralized hospital staff vaccinated. And then they went further, and they really helped us out in Phase 1A by getting a lot of the community-based healthcare providers that are affiliated with MedStar vaccinated. And so that really helped us as a community because it allowed us to then use our local health department vaccine supply and focus that vaccine supply to the rest of the 1A group.
Okay, well, you've helped me. They're not doing the general public.
They're not doing general public,
Got it.
no.
Thank you.
Mm-hmm. Yeah, thank you. Except for those immune-compromised individuals that are receiving hospital-based care. Yeah.
The more compromised.
Sure, yeah, or they're in the hospital, for example, with those conditions. Mm-hmm. All right, if we could go to the next slide, please. All right, so just to, Commissioner O'Connor, thank you for raising the great points that you raised about our challenge with allocation of vaccine doses from the state. Here in St. Mary's County, our St. Mary's County Health Department partnership is the main mechanism of getting vaccine into the general public's arms here in the county. We certainly are seeing a significant number that the base is doing. We're seeing a significant number that the hospital has done already for their staff and affiliated healthcare providers. Retail pharmacies here in St. Mary's County, if they're doing any vaccine, the numbers are about 20 or 30 a day, somewhere around thereabouts. Our partnership mass vaccine site that we're running can easily accommodate a couple thousand even vaccines a day, and if we expanded ours, we could do even even more. But we don't do that many because we don't have the vaccine supply to warrant it. We also are doing, as Commissioner O'Connor raised, we have several teams from the health department that have been going out into the community, into specific settings, high-risk settings, and providing vaccine in those settings. So in addition to the mass vaccine site that we're running, we're also doing a variety of these community-based efforts for these high-risk type of congregate settings. These are the doses that have been allocated from the
Brewster,
state. Yes, sir.
Just to add to that, I think one of the most important things out of this when we start talking about our vulnerable population and our population in general is equity. And when we're looking at how the vaccines have been, well, the state hasn't said reallocated, but again, if you dive into the data with a finite amount of something, in order to increase it one place, you need to decrease it another. So equity becomes a very, very, the word for me, the problem that we're facing when we look at our county and the drive that some people have, the access to vehicles, the access to public transportation to get there, you know, and the unwillingness and it's been noted in the minority community to actually get the vaccine, where now they're calling on faith-based groups to try and step in and say, hey, look, you know, this is okay, you should get this vaccine. Focusing on our county being rural, we have a network set up that's here, and I'm very, very concerned about the equity that our citizens are not going to be getting with the diminished amount of vaccines that you have. Just like you said, you could treat thousands. So are we doing anything, raising concerns with the state? Are we waving the flag on that one and saying, hey, look, you know, what are we doing?
Yes, and you have as well, and thank you for that. You know, it's every week, several times a week, not just me, but the other local health officers as well, are raising our concerns about the diminishing supply of vaccine to local health departments at a time when the state is getting increasing supply of vaccine from the federal government. When we know that local health departments are the most efficient mechanism of getting vaccine into arms at every local jurisdiction, and when we know that local health departments are system managers, we have an understanding of the different partners that can be activated to work with us. We have an understanding of the different providers that can be activated to work with us in getting vaccine out. And we have an understanding of the different needs of our population, you know, and the things to consider, like transportation barriers and distances and communities of that are even more vulnerable. And so it is you know, it is a concern of ours as local health officials that we are not getting the vaccine supply that would allow us to operate at to our full capacity, and to do so in a way that's local, right? To do so in a way that people don't have to take more time off of work to travel to regional sites and more time off of work to wait in long lines at regional sites that are processing 10, 15,000 people from all over the state and maybe even from DC and Virginia. So we do hope that we are able to restore and improve the vaccine supply that local health departments are being allocated so that we can better serve the needs of our residents and do so locally.
Dr. Brewster, this is such an important topic, and for the people watching, this isn't new news for the commissioners. We're very much aware of this. You've kept us informed about this. And so it's a couple different issues all at one time. One, the supply of vaccine, and we want more supply of vaccine, but also the ability to have a little bit more local control and flexibility in distributing the vaccine, because like you've talked about, you can do it better than what the state thinks they can do it. We just know the area better. We know how to distribute it better to St. Mary's County. But then also, I don't think we've talked about this morning, just getting the knowledge from the state of how many vaccines are coming in a timely manner. That's such a huge issue for us.
Yes.
And it's causing so much frustration with people because they want to be able to sign up, like Commissioner Hewitt keeps talking about, they want to be able to sign up for these vaccines, but then we have to delay because we don't even know how much vaccine is coming, and we can't make appointments for vaccine that doesn't exist.
Right.
So it's just, this is a really complicated, it's really not that complicated. It's unfortunate that it's become such a difficult issue.
Yeah.
When we should all be working together a little bit better.
Agreed. And to be fair to the state, they're also waiting for notification from the federal government as to how much vaccine supply they're going to get every week. And so that does limit their ability to give us advance warning. Our concern is they're getting notification on Tuesdays, essentially, from the federal government. And local health departments are finding out. I mean, this week we found out on Saturday, close to the afternoon. So when you delay that much, and then we have less than 48 hours to plan our clinics and get the word out and get people registered, and I mean, we have 50+ people working these mass vaccine sites. We have to activate them. They need to make plans in their own schedules and arrange for childcare and take time off of work if they're volunteers with us, and do all these things. That's a lot to coordinate at the local level when you have such a short time and knowledge of how much vaccines you're getting and how to then mobilize those clinics. We've been able to do so. We've been able to do so successfully, though, and that is a huge testament to the partners that we have in place that have been working so well together to make this happen. But I do absolutely additional time would allow us to not act in a frenzy, and would allow our residents to feel more confident that they do have an appointment in their hand. Even if it's not this week, if they know they have an appointment next week, then it definitely reduces the stress and anxiety that all of our residents are experiencing.
Do you keep track of your demographics as to
Yes.
and whatnot?
Yep, we do.
I know the answer to this question because I've already filled it out and asked you all those things.
Sure.
Do you see any, if the county's, I don't know, probably 22% African-American, are you seeing any discrepancies in the
Yes.
rollout?
So if it's okay, if we could go over to the next slide, I'll start talking about some of those metrics. And then I don't have a slide specifically on race, ethnicity, but I can talk about it for sure. So again, as I mentioned, the partnership effort that we have going here locally has administered 100%. And I put plus there because sometimes we're able to draw extra doses off of some of the vials of their first doses.
You're with Pfizer versus
It is
Moderna.
easier with Pfizer than with Moderna. Yeah, unfortunately, this week, we're only getting Moderna.
Okay.
Yeah. If we go to the next slide, please. So this goes into the metrics and the demographics. So first dose, so far, about 12% of our population here in St. Mary's County has received their first dose of a COVID-19 vaccine. So if we look at that 75 and older age category, and these are based on population estimates from the census, if we look at the 75 and older age category, 52% of St. Mary's County residents who are 75 and older have now received their first dose of COVID-19 vaccine. The next category of 65 to 74, which includes that 70-plus age group as well in that range, 41% have now received their first dose of vaccine. And then 8% in that 16 to 64 group. So certainly, the 16 to 64 group is a much larger denominator. I mean, we're talking about 75,000 people in that group. And then 65 and older, including, the 75 and older group, that's about 15,000 residents here in St. Mary's County, approximately. Certainly, we're making good progress on getting more and more residents who are 65 and older vaccinated in our community. I agree, there are thousands more who want to get vaccine, who we want to get vaccinated, and we're working with Department of Aging and Human Services to try to prioritize those individuals who don't have access to computers and need a little bit extra time through that callback mechanism. So we are trying to make sure that we can have some access to appointments for those individuals that, so the appointments don't just get eaten up by the people that are tech savvy right away. But we're getting a small number of doses. By state order, we're required to reserve at least 100 doses a week for childcare and education. So out of that allotment that we get, we have to reserve a certain portion of it for that childcare education sector.
I heard Dr. Smith speak last night. He was saying all the teachers who want to have a vaccination have been vaccinated.
The majority, some did not get it, but they are being offered through that portion that we have to reserve every week.
Saying, they have been vaccinated. The teachers have been
The
vaccinated.
majority of the public school system who want vaccine have been vaccinated, yes.
Again, I say the people who want it,
Right.
it's been offered to all of them.
Yes.
Yes, that's the
Right.
point.
There are some who want it who have not been vaccinated yet. We're working through those numbers every week with that, allotment that we get that we're required to save for childcare and education. But we're also doing that with the non-public schools, and we need to do that with our childcare facilities as well.
Tell me this. This lady goes to my church, St. John's, and on Sunday she was telling me that, she heard about it opening Saturday at 5 o'clock or somehow got the word and got over there to her computer and doing her thing. And the Lord knows, she said it took her so long to get through the computer questions and all that it was like 5:12 or 5:14 or whatever.
Yeah.
And when she was finally ready, she, hit that.
To sacrifice
So
and a community.
Apologize, Commissioners, I'm loading something else.
well, here's what I'm getting at. Can people preload that if they know, okay, they
Yeah.
can't do it until the window
We're
opens?
required to use a statewide system. It's a PrepMod system. That system, we've given a lot of feedback on that system to improve it.
Got it.
It does not have the capability of people establishing a profile and then going back and then just selecting an appointment with that profile. I wish it did. I think it would be a lot more efficient if it
People who are
did.
older,
Yeah.
don't have a lot of computer usage.
Understood.
And then when they get through these things where
Sure.
her point was, hey, look, it kept saying I didn't fill something out. And you have to go back through the page and find your red X and
Agreed, and that's part of the frustration that we have, is that we don't have the, at this point in time, we don't have the authority to use a better system locally. And what I think would make a lot of sense would be to have each jurisdiction, either you have a statewide system, but one that's efficient, so you don't have pharmacies have their own ones, and various providers have their own ones, and you've got, multiple
again,
different systems.
I talked earlier about maybe prioritizing, but I'll use the golf term handicapping.
Mm-hmm.
If you're 75 and older, you can tune in 6 minutes early or 10 minutes early to start the process. Because that's essentially what's happening, is people who are older and don't have those commuters.
But our system doesn't give us the ability
I
to
know,
block
but
appointments.
This is ideal world.
Right, agreed. I completely understand. Unfortunately, the data system we're required to use, the registration system we're required to use, does not give us the
What it is.
the ability to say, okay, we're only going to open this to people who are 75 and older at this point in time, and then 10 minutes later, we'll open up
I always
to
hear these
others.
grocery stores doing the senior thing where,
Sure.
BJ's an hour early.
Right, understood.
Dr. Brewster, I think it's important for the press and the public to hear what you just said. The form that you fill out online is a state form.
Yes.
It's mandated by the state of Maryland. It isn't St. Mary's County. It isn't our local health people. It's the state mandating what we're going to have to do. So please don't, when you're complaining to us about the form, it's like talking to the hand. It's that we can do anything we want to, but we can't change that form.
Yeah.
And also, I think it's important when you recognize what happened last Saturday. Last Saturday, we used to get our numbers on Friday.
Mm-hmm.
We didn't get our numbers till Saturday. We got 700 doses. 100 got to get reserved. The window for registering opened at 5 p.m.
Mm-hmm.
If I remember you talked to me correctly, in 9 minutes, 9 minutes, it was full. So we understand your frustrations, not only with the form, but the sign-up process.
Mm-hmm.
But please bear in mind, Dr. Brewster and her team are doing everything they possibly can, but they only have so much control over what the state lets them be able to do. So
Yeah.
I'm giving you a plug
Thank
that
you.
you're doing great.
Thank you.
And as Commissioner O'Connor said, it's the state.
Yeah, thank you for raising that. And we give feedback to the state to that registration form. And they have made updates to that registration form. If you notice, we disabled the requirement to submit or the fields where people upload their insurance card and so forth. And the idea behind that was to make it more user-friendly. We're not charging anything for this vaccine, so there's really no reason why we need to collect, all the insurance information. So the idea behind that was to make it more user-friendly and to make it a quicker process.
Good.
But and the state has updated, different parts of it. Unfortunately, the system, the basic part of the system is not something we can modify, which is you can't just create a profile or pre-register, which would be ideal if you could, but you can't. You have to enter in all the information, wait till you get to the end, select a time, and if no time's available, then you go to the next link and you enter in all the information again, go to the end, and see if there's a time available.
It's just ironic that they expect, they want to target the higher, more vulnerable populations, the older, but those people are the people who may be the most challenged by trying to go through this computer program to sign up.
Yeah.
So some parts of it are kind of...
Yeah. And again, that's why, we figured out locally what would help. And locally, we figured out that the Department of Aging and Human Resources, or Human Services, and the library system are incredible partners who are helping people. They're making computers available. They're coaching people through. They're keeping a callback list to assist people over the phone who struggle with the computer registration system. And so our local partners have helped mitigate the challenges of the state system. So, and I do thank them for that. That's pretty incredible work.
You have hit the key word: local, local, local. And the transparency that is lacking from the state and the lack of willing to listen to the local input, they have no clue that a good majority of the people trying to get vaccines would not have been able to even get vaccines based on their system if it wasn't for the local governments and the local assistance that knows their population, working with the population, handling it, making sure that they can get in. I mean, I got an email from the Assistant Secretary of the Department of Health, and, they're even using antiquated numbers. They're using our population from 10 years ago to go ahead and dole out vaccinations. They didn't reach out to economic development. They didn't reach out to the county. They didn't say, hey, what are your numbers now? So they're using 10-year-old data to say, this is how we're going to allocate. I find that truly amazing that in this crisis, they're using that type of antiquated data, not listening to our local public health officials. Even the email that they sent back, when he sent it to me, I said, wow, they are really out of touch with reality with the local governments. There's no way they could possibly understand what's going on here. And I just have to tell you, it's frustrating beyond all belief that they're dictating this down to you when we're leading the way for the state. We are, and the model, they came down and looked at us and said, you're doing it the best. So this is why we're going to come down and see how this is done. So part of my frustration, but I feel that as an elected official that patient advocacy, if the state isn't listening, is also my responsibility. And that's the only way they're going to listen up there, that if we have enough voices that say, hey, we're here, you need to listen to us, you can't just do what you want. And if they're going to continue to do what they want, but at least we can say you can't do what you want. So I hope that makes sense, but I just want to drive that point home. I really did.
Yeah, Commissioner O'Connor, the state's using 2010 census data, because that's all they have current. The 2020 hasn't been released yet.
That's it.
And that's what they're doing, which is way off, no doubt in my mind. I agree with you on that. But that's all they're going by is the 2010 census, which has tremendously changed in the last 10 years. One other thing, Dr. Brewster, on the release of the 700 doses, did the state give you any reasoning why we got cut right in half from the following week?
No.
No reason at all?
Our understanding is that there's ongoing supply coming from the feds. In fact, we've been told that the supply is increasing from the federal government. When I say we, I'm saying the local health departments were quite surprised because many of us had significant cuts to our vaccine allocations compared to what our prior trends are. And if you go back to this, thank you. This slide shows you what a significant drop this is. This is the lowest number of
This is
vaccines.
over all the counties in the state?
Well, all the counties in the state have different numbers, and I can't speak to every county in the state. I do know that Calvert was allocated 500 doses. We were allocated 700. Charles County was allocated only 1,100 doses. So there's variation, of course. Their point is they're trying to go by population, and that's influencing their allocation decisions. They've also rolled out these mass regional vaccine sites, the state-run ones like at Six Flags and Baltimore City. And obviously, when you roll out a state-run regional mass vaccine site, you need to make sure you have thousands of doses allocated to it. So that does raise the question: is the allocation of doses to these mass sites now diminishing supply to all the local health departments? So that is definitely a concern.
That's my theory, too.
Yeah.
Well, it appears this is a good time I move to approve sending a letter to the governor requesting more vaccines with St. Mary's County Health Department.
Thank you.
Second.
I have a first and second. I'll send a letter to the governor. All those in favor? Aye.
Thank you,
Aye.
sirs.
Any disapproval? Ayes have it.
Thank you, sirs. If we move to the next slide, I just wanted to wrap up and make sure the last slide before we get to the video there, the one before here. This one here. So it says second dose. It's actually about 5% of our population now has received their second dose and are fully or receiving the full immune protection that's preferred with the 2-dose regimen. Commissioner Hewitt, you had raised earlier the question about race demographics.
Yes.
So of the vaccines that have been administered, about 8% of those, 9% of those vaccines have been administered to African American residents in St. Mary's County. About 1.5% have been administered to residents who identify as Hispanic Latino in their ethnicity. So that is far below the percentage that African American residents represent in our total population, as well as that those who identify as Hispanic Latino as ethnicity represent in our total population.
Have you found reasons for that data? Is it because A, there's afraid to get it done, or B, they can't get on like the rest of these people can't get on with the
Sure,
computer?
there's a variety of reasons, just like with all populations, there's a variety of reasons as to why they may have some vaccine hesitancy. It also, caused a question, what are the demographics of the current eligible categories for vaccine?
Good idea.
And as we start opening up more and more categories, then it becomes more like our general population in terms of the race ethnic distribution. We, as Commissioner Morgan had talked about earlier in another meeting, we have had some ongoing conversations with the local NAACP chapter as well as our Minority Outreach Coalition. And the Minority Outreach Coalition is a great partner of the health department and has been for many years in extending and making sure that our public health efforts are impacting the minority communities here in our county. And so with those conversations, we do have some initiatives that we're going to be rolling out, which I'll announce later. But we're looking forward to seeing the benefit of that local partnership and getting more and more of our residents who are eligible and who are minorities vaccinated. I think the key here is we've seen with COVID since the very beginning that there's great disparities related to the COVID pandemic in terms of its impact on minority communities across the country, but certainly in terms of the numbers of cases and the fatality associated with COVID has disproportionately impacted African American residents and residents who identify as Hispanic Latino. And so that's part of the reason why we're concerned about vaccination rates in those groups as well.
Sure.
Thank you, sir. Good. All right, so we talked quite a bit about vaccine and our consternation with the vaccine supply. I thought perhaps if okay, we could end on a positive note. And I want to thank Commissioner Colvin, who came out and was present for our ribbon cuttings of our two new school-based health centers here in the county. We're really excited about what these facilities will do, both for child health and school community health, but then also for the health of the communities in which these school-based health centers are located. So this is a product of a great partnership between the health department, the public school system, and the sheriff's office. You know, if you remember, we had launched that equity task force in the summer, and we're looking forward to coming in front of you, hopefully in another month, and giving you an update on all the work of that equity task force. But this is one really exciting feature that we've just launched, and the school system has put together a small video of the 2 virtual ribbon cutting events that we held for both the Spring Ridge Middle School School-Based Health Center as well as the Margaret Brent Middle School School-Based Health Center. So I'll let you show that, and again, if you have any questions, I'm happy to answer them at the end, but thought this would be a nice way to end our meeting on a positive note.
Thank you for the great job you're doing. Keep it up.
Thank you, Commissioner.
When we look back on 2020, a year of tumult, isolation, and quite frankly, a bit of anger, we'll need to remember there were heroes who rose, leaders who sacrificed, and a community that came together to carry us through. Now, we're still in the middle of that story, but today's ribbon cutting stands as a shining example of how vision can carry us all through darkness.
And that vision was the vision for 2 school-based health centers to be opened in St. Mary's County. In a partnership with St. Mary's County Health Department, St. Mary's County Sheriff's Office, and the St. Mary's County Public Schools, health centers at Spring Ridge Middle School and Margaret Brent Middle School were established to represent equity in education, health, and public safety.
We know that healthy kids do better in school and they stay safer in their communities.
School-based health centers help to improve educational outcomes by providing healthcare and wellness activities that allow students to be seen by healthcare providers such as a doctor, physician's assistant, or nurse practitioner. Once seen, a student can often return to class as appropriate.
These school-based health centers will serve an immediate need. They will assist us in responding to the COVID pandemic and spreading health services out. They will also help us expand behavioral health supports for our children at a time of great community and family strain.
School-based health centers will initially offer supports for students, including those provided by school nurses, behavioral health services, preventive care, and health education programming. Future plans for the school-based health centers include specific primary care services, key to improving health outcomes for students who face barriers to accessing health care.
As our kids get back to school, we need to surround them with the best supports we possibly can to help them transition into a new phase of learning. Our vision for these centers is to serve as primary care access points for not just students and teachers, but for the neighborhoods where our schools are located.
I hope our efforts inspire others to see what's possible when we put our hands, hearts, and minds together to do meaningful work.
For more information on the St. Mary's County Equity Partnership, visit www.smchd.org/equity.
That's real good.
Great.
And when we're working on getting them, getting grant funding, we've applied for grant funding to support staffing in those facilities. We'll work on a sustainability plan as well so that we can build the concept of primary care for the whole community through these school-based health centers. And we're really excited about the future with those 2 new clinics. And I'm eager for everybody to come down when you have time and give you a tour of what it looks like. So thank you.
Thank you. Any other questions, Commissioners?
Well, another good news, your lab is all set up, right?
Yes, great news, and thank you to Department of Public Works and Transportation. They've been phenomenal. So yes, thank you for raising that. I forgot to mention the BSL-2 lab at the Health Department. The hood is now installed. It's inspected and certified, the fume hood. We are getting all the paperwork in place for it to actually be a BSL-2 lab. at the state level. It needs to be recognized that way. And then we have the protocols in place, and we'll be ready to roll out. Once we have all that squared away, we'll be ready to roll out some rapid PCR testing, not the rapid antigen testing, which isn't as great of a test, but rapid PCR testing for our first responders and healthcare workers who have symptoms and need testing for COVID-19.
Well, real quick on that topic, we've heard about rapid testing, but we're hearing it's like 30% accurate. Is
So
that,
there's rapid antigen testing. That's what most people are getting when they're getting rapid testing in our community. Go to urgent cares, for example, and they offer rapid testing. Most of that testing is rapid antigen testing. Rapid antigen testing has a high rate of false negatives. And we've also seen some level of false positives. So people, if they get a positive with a rapid antigen test, they're supposed to send a confirmatory PCR test as well, just to make sure it is a true positive. But not everybody is sending a PCR confirmatory test with a negative antigen test. And so that's what we're concerned about, is some of the negative tests related to the rapid antigen tests are actually false negatives.
okay, so again, is it back to the 3 to 5, 7 days to get your test results back?
So the rapid antigen tests come back quickly. They're the point of care testing.
But they're not very accurate. So if you have to
Or
get one.
PCR testing. So PCR testing, so rapid antigen tests have a good role. They have a good role in like universal screening. So when we go into a facility like a nursing home and you're testing, 400, 500 or more people, and you do that once a week, but then you also once a week do universal testing with PCR testing. That's what our nursing homes are doing right now. Then that gives you at least, you can do something with the rapid antigen. It's like a screening tool, and then you then confirm it with the PCR. It's a little bit more challenging to use that in a community setting on an individual case-by-case basis because there's certain situations where a rapid antigen test would be better to be used, like in somebody who has active symptoms versus in the asymptomatic, or if you've had infection for several days already, it may not be as reliable. The PCR test, we've been seeing fairly good turnaround times with that, at least through the health department PCR testing, 2 or 3 days. And we've rolled out a new laboratory. We switched our contract to a new laboratory so that, again, people should be, one, getting through the line a lot quicker than what we've had in the past when we've had to use another laboratory and we didn't have the IT infrastructure in place to move the line quicker. But now the lines are moving very quickly through our testing sites. And you can get your results directly through the patient portal, usually in a couple days.
Good news is it's getting better.
It is, yes. Now, if we have a surge in people getting tested across the state, that does slow down the laboratories, and it does slow down the number of days that it then takes to get your results.
Thank you.
Thank you.
Anything else, Commissioners? No. Well, Dr. Brewster, thank you very much for your presentation. It was
Thank you,
very
sir.
informing, and we have to support you 100%. Hopefully, we get more vaccines somehow.
Yes, thank you. And thank you all for your support. It's been tremendous, this whole pandemic, and then especially with this
I would
vaccine.
say our volunteerism is truly outstanding in St. Mary's County for the people that have showed up to help out
Yeah,
at
it's
these
been
sites.
great.
So I'm very impressed.
It's
Thank you.
awesome.
Thank you. Well, I'm going to move to adjourn as the Board of Health and reconvene as the Board of County Commissioners.
Second.
I have a first and second. All in favor? Aye. Any opposed? Ayes have it.
Thank you.
Thank you, Commissioners, and we return to the County Administrator agenda items for item 3C with the Department of Aging and Human Services from the Governor's Office of Children for the Community Partnership Agreement for FY21 Local Management Board and Subrecipient Agreements. Lori Jennings Harris, Director, Department of Aging and Human Services, presenting this morning. Good morning, and thank you for your patience and your flexibility with the change in schedule today.
Good morning, my pleasure.
Good morning, Laura.
Good morning, Commissioners. Joining me this morning by way of WebEx are Cynthia Brown. She is the Human Services Manager for the Department of Aging and Human Services. Also, Latay Reeves. Latay is the Youth Coordinator and Local Management Board Liaison, as well as Tammy Lowy, and Tammy is the Local Management Board President. So as Dr. Bridget just mentioned, this is the FY21 Community Partnership Agreement from the Governor's Office for Children, FY21 for the period July 1st, 2020 through June 30th of this year. The allocation for this year is $406,446, and the agreement establishes support services for families, youth and families. We also have 5 subrecipient agreements between the county, St. Mary's County Public Schools, Center for Children, and Tri-County Council for Southern Maryland. Happy to answer any questions you may have.
I'm surprised our part of it's $1,102 and the state's doing $406,000. Lord knows, how do we get such a good deal? And thank you very much.
You're welcome. We've received these funds for a number of years, and the allocation hasn't changed much over the years. It's not unlike a number of grants that we receive, where the majority of the funds come from the state and the county's contribution is less.
I've just seen ones where our portion has been higher, so this is good.
Yes, thank you.
I'll make a few motions, please. I move to authorize the county LMB chair and department staff to execute the fiscal year 2021 Community Partnership Agreement, Appendices A and B, and authorize the Commissioner President to sign any related documents.
Second.
I have a first and second. All in favor? Aye. Any opposed? Ayes have it.
Aye.
I move to approve the Commissioner President to execute the fiscal year 2021 Community Partnership Agreement for project numbers MD 2160, MD 2162, MD 2163, MD 2164, MD 2167, MD 2168, and MD 2188 from the Governor's Office for Children in the amount of $406,446 state funds and $1,102 county funds for a total of $407,548 in related budget amendments.
Second.
I have a first and second. All in favor? Aye. Any opposed? Ayes have it.
I move to authorize the Commissioner President to execute the subrecipient agreements between the county government and the St. Mary's County Public Schools, Center for Children, Tri-County Council for Southern Maryland, and other related documents.
Second.
First and second. All in favor? Aye. Any opposed? Ayes have it.
Thank you, Commissioners.
Thank you, Commissioners. And item D is from the Department of Public Works and Transportation.
Thank you very much, Lori.
You're welcome. Thank you.
With resolutions to accept various roads into the county highways maintenance system and establish speed limits. Mr. Diedrich, Director, DPWT, presenting this morning. Good morning.
Good morning. This is pretty typical of what we go through. We've got a series of streets by 3 developers in 4 different locations, although 2 of the locations are directly adjacent to each other, that we want to bring into the county maintenance system. They're completed. They're in excellent condition. We've got a year maintenance bond on them, though, so that at the end of that year, we go take a look at them and make sure nothing's gone wrong with them over that period of time. And at that point, the maintenance bond's released, and we're ready to go. So we got Eldorado Farm, which is off Golden Beach. We've got Hilton Run, Elmar Street, and Nick Street, which are in Lexington Park. And then we have a series, there's 5 different streets that are all in Hollywood, adjacent to each other in 2 different subdivisions, Twin Ponds and Broad Creek. So we'd like to be able to bring these into the system. So could I have the first slide, please? I'll go through this quickly. Just have 4 slides to show you where these are.
Seems like good timing for these residents right before all the snow that's going to come later this
The
week.
blizzard, the sky is falling.
Commissioner Morgan doesn't believe it's going to snow.
3 to
but-
5 inches, right?
So it's okay if you,
I've got it. Just a second. There we go.
there it is.
There you go.
Right, so there's, you can see Golden Beach up there at the top of the screen, Eldorado Farm Drive. We've definitely got a series of houses that are already on that site. So, next slide, please. These are the ones that are the ones in Lexington Park, Rainier subdivision. And next slide. Twin Ponds off Hollywood Road.
I had some questions about this one when you're ready.
Go ahead.
The people reached out to me a couple of years ago. I think there's a Karen Court there, yes. And as that FWD goes up, as
Yeah.
it goes past Karen Court, that the water's been running down and washing out a section of this one constituent's backyard. He had actually gone in and put some soil in there and whatever else been done and trying to fix it and didn't fix it, and now it's back. Did we ever determine if that was graded right, a swale was needed, or I'm a little sensitive to accepting this because I believe that those contractors, and whoever's doing that subdivision is responsible for that water.
All right, well, that's further up FWD, closer to Hollywood. We met with the owner. When we rehabbed that section of FWD last year, or was it this year? We actually tried to figure out if we could raise a cross pipe which flows into his backyard, and but we couldn't. So apparently someone in the past had filled what was a wetland
It was a wetland.
Yeah, with concrete block and other concrete waste. And because it's up at, the pipe is at this level, and now the yard is almost at the same level. So there really wasn't anything we could do unless we would have raised the entire road up, which wouldn't have been practical at that location because it would have affected.
I get that. I guess the thought was they had indicated to me that before this subdivision was approved back in there, they didn't have that issue with that runoff. Now, again, I don't know. I'm just hearing what they told me. And that, secondly, once the road was put in, the water coming from the upper area came down at a lot higher rate and fed through that pipe and actually gave it directional push to a road out an area. And I think that's why they ended up with the block and the debris in there to try and fix that. But that's not going to be fixed, is what you're saying.
So are you talking about the owner of Bollywood?
No, I'm talking about the corner of Karen Court.
Yeah, that's
FWD.
That's his house.
Okay.
That's his house.
So, no, there's really nothing we can do at that location because of work that apparently was done when they built, at some point, either when they built a house or after some previous owner before he owned it. So it's not a county issue in our mind.
But we won't be putting more water down there by...
Oh, not with this. This development is actually at a lower, it's actually down a hill.
The crest?
Yeah, right. So the water from this goes to a different location. It goes over towards Three Notch in St. John's.
Not like we never did anything about it then. We just said that's the way it is and you're just going to...
Right. Yeah, we met with him a couple times. We tried to figure out how we could lower the pipe, or raise the pipe rather, sorry, and to try to get it to flow better over his yard and allow more fill to be put in.
He was one of the
just
ones that
didn't
did
work.
reach out to me, even though someone else did for him. But two other people reached out to me and said, let me give you the real story, whatever the real story
Okay,
is.
well, just...
They've been living there a long time, though.
Okay, I'll be glad to, anything you can feed me on that, some contacts, I'll be glad to
Let me just say
go back
this.
out
They
and
haven't
go
called
through
me
it.
lately. I figured it was taken care of. But then when I seen this road come up for approval, that's why I wanted to bring it to your attention.
I get it.
Don't call me, I won't call you.
Please feel free to do it, though, if you hear anything. You can see that blue line that runs through this particular slide, that's actually the stream where all the water from this development ends up.
Okay.
Right.
Yeah. Okay, last slide, and we'll just wrap this up. This is the adjacent development by another developer, and that's it. I'd like to ask your approval to bring these into the county system.
Okay, I'm going to move to adopt a resolution to accept El Dorado Farm Drive into the St. Mary's County Highway Maintenance System, and to adopt the ordinance setting a maximum speed and establishing stop intersections for that road of El Dorado Farm Drive subdivision.
Second.
I have a first and second. All in favor? Aye. Any opposed?
Aye.
Ayes have it.
I'm going to move to adopt a resolution to accept Hilton Run Court, Almar Street, and Nick Street into the St. Mary's County Highway Maintenance System, and to adopt the ordinance setting a maximum speed and establishing stop intersections for those roads of Ranieri Run subdivision.
Second.
I have a first and second. All in favor?
Aye.
Aye. Any opposed? Ayes have it.
I move to adopt a resolution to accept FWD Drive and Gregg Street into the St. Mary's County Highway Maintenance System, and to adopt the ordinance setting a maximum speed and establishing stop intersections for those roads of the Twin Ponds subdivision.
Second.
I have a first and second. All in favor? Aye. Any opposed?
Aye.
Ayes have it.
And I move to adopt a resolution to accept Daphne Drive, Barbette Drive, and Quail Street into the St. Mary's County Highway Maintenance System, and to adopt the ordinance setting a maximum speed and establishing stop intersections for those roads of the Broad Creek subdivision.
Second.
I have a first and second. All in favor?
Aye.
Aye. Any opposed? Ayes have it.
Thank you very much.
Thank you,
And-
Commissioners. And item E is also from the Department of Public Works and Transportation with the FDR Phase 3A fee easement acquisition for the Hill option contract. Mr. Diedrich?
Thank you. This particular item, we'd like to ask you to approve the option contract for a small piece of property at MacArthur and what will be FDR Boulevard. It includes a small piece of property for fee in order to construct the roundabout at that location, and construction easement, and it also replaces the gentleman's fence that owns the property because we impact it.
I move to approve the option contract between John D. Hill and the Commissioners of St. Mary's County for easement acquisition needed for constructing FDR Boulevard Phase 3A project, and authorize Commissioner present to sign the related documents.
Second.
I have a first and second. All in favor? Aye. Any opposed? Ayes have it.
Thank you very much.
Yeah.
Thank you, Commissioners. And from the Department of Human Resources is a proposed update to the Handbook of Personnel Policies and Procedures for Hourly Employees. Catherine Pratzen, Director, presenting this morning. Good morning.
Good morning. Hi, Commissioners. You may recall that in early January, you approved updates to the personnel manual, and here today are these policy provisions as they apply to the hourly employees. In the memo provided in the document, or in the items 1 through 6 were previously approved by the Commissioners for incorporation into the policy manual, and they are being adopted in the hourly manual with approval. The only policy change that is different from what the Commissioners previously considered is item 7. Currently in the hourly handbook, hourly employees are authorized callback pay. And there is the suggestion before the Commissioners to consider eliminating that option for hourly employees. This primarily impacts our Department of Emergency Services, and the other departments don't have hourly employees that they're calling back to work. And the feeling is that the callback pay should be limited to full and regular part-time employees who work a consistent schedule, who are being called back in, and hourly employees should be paid for hours worked as they are. And then when their hours worked exceed 40, they're paid overtime. And in emergency services, they feel that this can be, has been abused by hourly employees in the past with how their schedules are published.
Now tell me, we've had this policy of if people are on call, they're at home and they're on call, that they're going to be paid while they're on call. Now, how's this change? We don't do that for hourly employees?
That's a separate policy.
Okay, so I'm confusing my policies.
And hourly employees have not been historically on call.
Okay, that's the difference. Hourly are historically not on call.
Correct. Yeah, and in all other departments, hourly typically are not called back in either.
Okay.
Any other questions, Commissioners? I need a motion.
I move to approve the proposed updates to the Handbook of Personnel Policies and Procedures for Hourly Employees as presented.
Second.
I have a first and a second. All in favor? Aye. Any opposed?
Aye.
Ayes have it.
Thank you so much, Commissioners.
Thank you, Catherine.
Thank you, Commissioners. And item G is from the County Attorney to suspend redistricting board appointments. Mr. Weiskopf, County Attorney, presenting this morning. Good morning.
Good morning. Thank you for that introduction. I was getting ready to talk about legislative updates.
Good morning, Mr. Weiskopf.
Good morning, Commissioners. As you'll recall, last week I was in front of you regarding possibly suspending the Public Local Law 27-11, which allows that between January 1st and March 1st, St. Mary's County Commissioners must appoint the redistricting board. As you know, the redistricting board works with the 2020 census, and last word we got from the Census Bureau basically was like, don't expect it until July 31st, I think. So at first we were thinking it was going to come in maybe June 1st. Now it's been pushed back to, possibly August, it looks like, hopefully, if everything works well. So what we're asking for, based on the governor's, one of the governor's emergency orders, if the commissioners so chose, it's three things. One, we had to inform the governor that we were going to do this. Two, the commissioners have to make a finding that, for the public safe, healthy welfare won't be affected by this suspension. And then three, if the commissioners so choose to do this, that we have to provide notice to the public of the suspension. And obviously, I would work with Dr. Bridget and our Public Information Office to provide reasonable notice to everyone. And when we spoke last week, the commissioners, I believe, wanted to say, stretch it out, suspend it to July 1st of 2021, which would give us plenty of time. And otherwise, we'd have to appoint a board to then just basically sit on their hands, right? Was the thought behind not doing it now. So.
Well, let's just say they wouldn't have anything to do.
They wouldn't have anything to do. Yes, sir.
Here's my first question is, this will allow the application process to stay open, right?
And we said yes to that. And so we are probably putting out something with the public. If this passes, we'll put something back out with the Public Information Office, a press release saying, send us your applications until, June 1st, maybe.
Yeah, for the record, I'll state that I thought we did get quite a few, but more is better. Now the other part gets to be that someone reached out to me in an email, and probably the rest of the commissioners too, saying, hey, why are you suspending appointing this board when it's so critical that they get this redistricting done? It's something's going on in Annapolis now, and people are really concerned about how the voting district's going to be. I think it's necessary for them to understand there's just no data for these people to analyze.
Right. The census is what they need to look at.
And they have no data to make the decision on.
Well, they have the 2010 census, right? The same thing the state's using for
the
vaccines.
State's using 2010 right now to give us
vaccines. Well, that's what I'm getting at, Commissioner President.
Right.
So my point gets to be is when people reach out to us and say, hey, what's behind this delay? It's not so much a delay. It is a delay. Right. But the reasoning is there's no data.
There's nothing for the board to do, as you said earlier, and there's no data until, like, hopefully by August 1st, right?
And then they have to finish it by December 31st.
Yes, so
On a short timeline once they get.
they're going to be on a short timeline, and there's also provisions within the redistricting board. It's public local law that states they have to have 4 public hearings. We might have to condense those. So we'll see, but we'll make sure it runs.
Wow. I support the idea of not appointing, but leaving it open for more people to apply.
Sure.
And we'll certainly do that.
Sure.
I move that the Commissioners approve the resolution suspending the appointment requirement for the redistricting board as it will not endanger the public health, welfare, or safety of the citizens of St. Mary's County, and the Commissioners suspend the March 21st, 2021 deadline until July 1st, 2021, for when the Commissioners must appoint the redistricting board.
Second.
I have a first and second. All in favor?
Aye.
Any opposed?
Aye.
Ayes have it.
Thank you,
And
Commissioners.
Mr. Weiskopf, I think you can stay seated because item H, Commissioners, I'd like to postpone the employment contract for this morning. And you already had the Board of Health out of order. So that takes you directly to your legislative updates by the County Attorney's Office.
So we're not doing the employment contract?
Not today.
Oh.
Thank you, sir.
Okay, thank you very much. I will get started on legislative update. And again, there are 2, so I'll go to the first memo. I'm a little bit briefer this week. The first one is and this is just something, House Bill 745 is election law, early voting centers, and number required. This is one that was, it's a statewide bill, and based on our population, we would have to have 3 early voting centers. MACO opposes it. The hearing is set for February 16th. I don't know if this is one that either of our contacts with MACO and the legislation have anything to say about it, or?
MACO was opposed.
Okay.
Well, tell me, would this be something that has to be manned, or could this just be a?
It's a mandated, it's a codified mandate that you would have to have more early voting centers in St.
I
Mary's
agree,
County.
but couldn't they be boxes? Do they have to be people sitting there?
It's just
No, this
like
would
we
be a
have at the
center,
Hollywood
just like the one we have in Hollywood.
So it'd be like Hollywood Volunteer Fire
correct.
Department.
Right. Based on our population,
Now,
it would
this
be
is
3.
different from Delegate Crosby's bill.
Yes, we'll get to his in a minute. His, I believe, is on Memo 2.
Okay.
And so, Commissioners, there is a motion for House Bill 745 if you'd like to oppose.
Okay, the reason we would oppose something like this, because there's increased cost. What's the impact?
Well, the cost is about $85,000 or $90,000.
Okay, now we have heard people claim disenfranchisement, and because of transportation or whatever. So by opposing this, are we, I don't think any of us want to disenfranchise anybody.
Right.
But our reason in opposing it is because we just don't feel it's necessary.
Well, you mentioned about transportation. What's the problem with transportation?
What'd you say?
What's the problem with transportation? You mentioned that.
Well, people have talked about if they live down in Lexington Park and they can't get out, they don't have transportation to get up to Hollywood. Or people who have lived along, that Hollywood can be central to a lot of people, but still a long ways for a lot of people too.
So actually, during this year's early voting, the STS bus stopped at Hollywood Firehouse several times. And I asked Mr. Dietrich that next time we have early voting, can we schedule that as an actual stop during the early voting process? And he said yes, he could add that in there. It'd be a bus stop.
Okay, so the point is, you don't think we need it, as far as we don't need this.
As far as I know, this is changing the mandate of, right now it's up to 100,000 registered voters, right?
Mm-hmm. Correct.
Yes.
Is the magic number. So anything under 100,000, you only need 1 center. Anything over 100,000, you'd have to have an additional second voting center.
Okay,
But
so
what they're trying to do,
we're under 70,000 registered voters?
Right, so they're trying to change this. No, we're at 73,000. So they're trying to change this to 70,000. We'd have to do a second center.
Right. The current law is that a county with fewer than 125,000 registered voters have 1. What they're proposing is that a county with at least 50 but fewer than 100 have 2. So it would increase us from 1 to 2.
And Mako's position was, this is not just a county bill, it's a state bill.
But state bill, so all the counties would be subject to this, not just St. Mary's. This bill subjects all the counties.
Correct.
I guess I just don't see what the harm is.
Cost, manning, that's the best thing I can see.
Well, what's Mako say? What's the harm?
Mako's position is an added cost, and with all the number of people who have had COVID, it's hard to staff these things. And as they said on the news last night, this COVID may be not going away, and it may be becoming something that
Even
will
more
be subject
difficult.
to a regular vaccination, like a flu shot, so we don't know. So we're just repeating Mako's words. We're not making stuff up here to discuss.
All right.
Any more discussion?
Mr. President, I move to oppose House Bill 745, election law, early voting centers, number required, and authorize Commissioner President to sign the letters of opposition to the House and Senate committees for hearings on this bill.
Second.
Can I have a first and second? All in favor?
Aye.
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 Any opposed?
I'll vote, aye, I'll vote for it. I don't see it.
I have all ayes.
Okay, the next was Commissioner Morgan had asked us to keep an eye on House Bill 589, Senate Bill 493, which is the Budget Reconciliation and Financing Act. If you recall, this is the one that would pass on the SSTAT costs to the county as well.
Okay.
Mako's position on this bill, they're still on hold, is my understanding, and no letters. The commissioners voted to oppose this bill on January 26, but no letters of opposition have been sent because the hearing dates have not yet been set for it. And
I
that's
think
what
Mako's going to take a stand this Wednesday.
Yeah, to be honest with you, last night we were supposed to have our rural council meeting, but there was a plethora of bills got thrown into the pile, and Mako was not able to sort them out completely. My concern would be here at this point in time, I believe that Mako, there's a lot more to the BRFA bill than just SSTAT.
Right.
And it'll be my sincere opinion that when Mako votes on the BRFA Act tomorrow, they're going to oppose.
What's the acronym you talking about?
BRFA, Budget Reconciliation and Finance Act, BRFA.
Are we talking about HB 1097?
No, we're talking about HB 589.
On first, the second one on,
Sorry, I got my pages mixed up.
that's all right.
So anyhow, the BRFA bill will be voted on by Mako tomorrow because last night they just had too much on their plate to handle. It's my opinion, in talking to my colleagues around the state on numerous bills that are affecting all of the counties, that the BRFA bill will be opposed by Mako, not just for SSTAT, but for a number of other things that are buried inside that bill that will cause, I would believe, significant financial implications to St. Mary's County if approved. So I would try to get, since we can't meet next Tuesday.
See, I'm sorry, I was lost over here.
the bill.
We have?
So
Yes, we've
you're on memo, not memo 2.
Yes, sir.
I apologize. All right.
We've already opposed?
Yes, sir, on January 26th.
Okay,
Thank
sorry.
you.
We just
talked too
we
long.
haven't sent the letter yet because we didn't have a
Right,
date.
because no hearing date is
There's no hearing dates yet, so we opposed it.
So this is
And
just a status.
what you got to understand, too, the reason we had a meeting last night is that even Mako is unable to get a lot of information. Some of these bills are being presented without any kind of written
Fiscal
testimony,
note, I've been drafted.
without any kind of financial statements. Everything has been really terribly confusing. And when you got Mako unable to track this,
Right,
that makes it almost impossible for us to track. And we got numbers and just a brief little 1 or 2 line
sentences.
statements is all we got about them.
Right.
So it's going to be interesting in the next few weeks what happens with some of these bills. And I got a feeling some of these delegates and senators are pushing these things on us. I mean, like right now, we have to sign up 4 days in advance to get on the docket to testimony, where before you used to be able to go to Annapolis, you go to the back of the room there, you sign up, and you're on the testimony. Now it's been all thrown up, and it's been very difficult for people to actually get up here and testify for and against some of these
You don't
bills.
get to go testify.
You can't go.
You have a 5-hour window within a certain constraint to be able to sign up, but if you don't hit the magic window, the citizens'
out.
voices are ignored
Right.
by the committees up there.
Right.
So it's an enormous amount of bills, more than ever, that some of these delegates are pushing through. And it's going to be an interesting session to be done.
certainly.
It's going to be terrible. And unfortunately, some of us are going to be caught on the back end with costing us a lot of money as they go through some of these bills.
So we're keeping an eye on it, and we'll let you know when a hearing date gets set.
Appreciate it.
Well, I would just request that the hearing date is within a window that we're off until whatever 2 weeks
To
is, so
let
that
you
we
know,
get our
certainly.
letter in on time.
Certainly. I couldn't ask for better staff regarding this, so.
Very good. I know they're working hard right now with this.
Absolutely.
I appreciate it very much. Thank them.
Next would be memo number 2, which starts off with House Bill 1005, which is Delegate Crosby's bill about early voting centers. And as the statewide bill, increases the numbers on all of them. Senator Crosby's bill just focuses on votes between registered voters between 70 and 125, and would go from 1 early center to 2 early voting centers.
So there's 2 bills on early voting centers? One
Yes.
is 50 and 100, and one is 70. Well, one of them is going to get dropped. I mean, you can't have bills that are totally incongruent with each other.
You wouldn't think so.
So.
Well, I'd be just stay consistent and say no.
And no hearing date for this one has been set.
The only thing I want to add to the conversation about Delegate Crosby's bills is, we have a process here. The process is that citizens are allowed to come locally and speak and or WebEx or whatever it is you want to have a conversation about. And each delegate has an opportunity to present the bills, which the other members did, before the commissioners and the citizens of this county so they can weigh in, especially because we know how Annapolis is with being able to get up there for a hearing, people commuting back and forth. Procedurally, I have just, I don't like the fact that people have snuck bills in under the noses of the citizens of this county and then turn back around and make it seem like we're the ones that are wrong for opposing these bills when there was ample opportunity. These 2 bills, I can tell you that I've had conversations with multiple citizens from the north end to the south end of the county, and they all oppose them. Every single one. There's there is a process, and this process was circumvented by Delegate Crosby, and it's a slap in the face to the citizens of this entire county that this is going to affect. Meanwhile, he just represents a district in this county. So every citizen did not have a chance to weigh in on this, and that's the only thing I have to say about it. But I just wanted to make sure I was able to get that out there.
Thank you, Commissioner.
Thank you.
And while we do not have a motion for this one, since the commissioners did a motion on the other one to oppose, do the commissioners wish to take a position on this one?
What's the House bill number again?
Oh, House Bill number 10.
House Bill 10.
1005.
I think we should oppose it.
I think we should oppose it.
What's Delegate Crosby's bill number?
1005.
100. I make a motion to oppose House Bill 1005.
Second.
We have a first and second. This will be drafted in a letter, right? And go out once we get a hearing date.
Yes, and we assume, Commissioner O'Connor, that you oppose the bill and authorize Commissioner President Guy to sign letters of opposition to the delegation and to the House and Senate committees for hearings on this bill.
Correct. That would be the full motion that needs to be presented. I accept that amendment.
Thank you.
Okay. We have a first and second.
To my original statement.
Okay, we have a first.
What's the motion again?
So the motion is to oppose House Bill 1005 and to authorize Commissioner President Guy to sign letters of opposition to the delegation and to the House and Senate committees for hearings on the bill.
Any more questions, discussion? We have a first and second. All in favor? Aye.
Aye.
I have 5 ayes. All in favor?
Thank you, Commissioners. And the next is House Bill 1097, just letting you know that this bill has been dropped, and it was the one for the local officials and salaries as put forth by the Compensation Review Commission. But no hearing date's been set. So just letting you know that.
Has been dropped, you said?
Has been dropped, but no
Yeah, I saw
hearing
that.
date has
Okay.
been set. And next, keeping you informed regarding the Kerwin, which is House Bill 1300, the blueprint for Maryland's future. We had heard last week from MACO that a vote would happen sometime in the middle of February. However, late yesterday, the House voted 95 to 37 to override the governor's veto, and the Senate is expected to override the veto later this week.
Later this week, yeah.
If you recall, the governor's reasoning for vetoing it, I think, was because of the unexpected, the pandemic and the unexpected costs we are going to have, but that's where we are.
Sure.
And otherwise, on the second page, we just had a list of some of the upcoming hearings. February 12th for the civilian members of the Law Enforcement Hearing Board for St. Mary's County. February 16th was the building excise tax. And Commissioner Morgan, Delegate Morgan said that oral testimony was not necessary, that written testimony would be enough. February 17th is the Human Relations Commission regarding the equal treatment update. February 17th is also the public facilities bonds. February 19th is the alcohol beverage 2 bills. And February 24th would be Metcom debt limitation 1. And that's my update, Commissioners. Is there anything else?
I'd like to ask you about HB 655, which is supposed to have a hearing today at 1:30. That's Delegate Crosby's bill to break up the way the commissioners are elected in St. Mary's County.
Okay.
But it's 5 counties, not just St. Mary's.
Well,
Right. This is a statewide
bottom
bill.
line is this is how it affects it.
Statewide bill.
Yeah, statewide bill. My point is, how can we view that? Is there a way that if we're home or people are at home and they want to, because I know I reached out to Delegate Crosby and he said, hey, just live stream it and you'll
Right.
see what.
My understanding is, and I can get you specific instructions from Ms. Blondino, but my understanding is somebody would go to the Maryland General Assembly website and you can search House bills. You can click, so you can put in HB 655 and all the information to that should come up, and hopefully one of the links on there would be the hearing.
Okay, I'm not a big streaming person. I've heard the word. I kind of understand what it means. But that means I can go to my home computer, bring up the Maryland General Assembly, bring up HB 655, and I'll have an opportunity to live stream that hearing.
I believe so, yes, sir. The same way as people have the opportunity to live stream this from their home.
Right, Channel 95, right?
Right.
Okay. Well, thank you.
That's my understanding. Okay.
Anything else, Commissioner? Mr. Weisskopf, thank you very much.
Thank you, Commissioners.
And thank your staff for all they're doing to follow these bills.
Absolutely.
I know it's a lot of problems right now, yeah.
Thank you.
Are you finished?
And County Administrator time is done. Thank you.
Thank you, Dr. Pritchett. Okay, we'll go right to Commissioner's time, and we'll start with Commissioner Hewitt this time.
Goodness, thank you. I recently rejoined Lexington Park Rotary Club after an absence of about 13 years. And they asked me to be someone who could find speakers. And last night, the speaker for the Lexington Park Rotary Club was Dr. Scott Smith, Superintendent of St. Mary's County Public Schools. He had a great presentation for us, very interesting information, and I'd like to relay some of it. Kids have started back into school. He said yesterday, the 8th, had about a couple hundred show up with their special programs, Compass and one other. And next 2 weeks will be another group going in, and by March 1st, they'll all be going in. And that's great news. Lord knows kids need to be back in school for more than just the instructional part. They need to be able to mix with their friends, and hopefully they can do all that safely. He also talked about the teachers who had been vaccinated and how that number was up in the upper 70% of teachers being vaccinated, and that, you know, there was some and other workers that work within the school system who are reluctant to get the vaccine, and that's understandable. But the good news is we're going back to school. Now, one question was asked, which I thought I would like to impart today, and they said, how are the students doing? How's the virtual learning working? And the response is about 40%, now I'm pretty sure I got this right, of the elementary level kids are below where they should be at this point in the year. And the point being is summer school is liable to be pretty crowded. He estimated up to 7,500 kids out of 18,000 kids going to school. Almost 7,500 could be going to summer school to catch up remedial. Now, anybody who's dealt with trying to do the virtual learning has understood the challenges, and Lord knows he talked about ghost students, students who are on the rolls and have the computer but never log in or log in intermittently. It's a problem. It's something we're concerned about, county government, across the county, across the state, across the nation. How are our kids doing keeping up with where they should be on the learning goals and the learning curves? So with that said, hopefully he did also say, good news, $3 million is coming from the federal government to help with this effort. Usually it's around $250,000. So school's in, buses are out there. Keep an eye out for the buses, and good luck, Dr. Smith and your teachers and all your crew, all your Board of Ed members, everybody who works in there, from the building service managers to all of them, getting this up and running, because Lord knows the kids need it. COVID. People reached out to me, and I've said it today with the Board of Health. Now, our health department's doing an excellent job. Dr. Brewster's doing an excellent job. Many people have talked about how seamless and easy the vaccination process is. A little intimidating when you show up with all those cones, but it moves very rapidly, and it's very well organized. So whatever we can do to get more vaccines, obviously we want to do. But what I would recommend after listening to Dr. Brewster today is, if you have the opportunity and you can get on that website, even if you're not your turn to hook up or sign up or get your appointment, familiarize yourself with the questions. Because that's what I've heard from seniors who are trying to get on. They don't know about their not their Social Security card, their Medicare card, or whatever card, health insurance card, and doesn't need to be there, but should it be there? There's a lot of questions. Key is to familiarize yourself with that site, so when it opens, you can be right on it and really, really on top of this game and get your vaccine. Lastly is the weather. Hey, they're talking about some really winter weather following into this week, into the weekend. Hopefully, it's not going to be snow. I know Commissioner Morgan loves snow. I hate snow. But it's winter. Good news is winter's more than half over, and it won't be long for spring's here. So let's hope for spring. Thank you.
All right. So I want to start off and wish everyone a happy Valentine's Day. That's coming up this weekend, so I hope you enjoy your Valentine's Day, and we'll see what happens with the weather that's coming up. We've had enough snow for me. I like to see one decent snow where the ground's covered, and now I'm ready for spring, but they're saying there could be more coming this week. Everyone's ready to get outside. Everyone's looking to get out and do stuff. If you're looking for something good this weekend and the weather holds out and is not bad, if it's bad weather, stay inside. Don't risk your life. Don't put others' lives in danger. But if it's not bad, the Leonardtown Volunteer Fire Department is putting on a fair food drive-through. Friday night, Saturday night, Sunday night, 4 p.m. to 8 p.m. You can drive right through the old carnival grounds. Probably bring back a lot of memories for people. Used to be the best carnival in the county. And you can go and get some delicious food, support local businesses. It'll be a great time those nights and make a great date night for Valentine's weekend. So finally, no meeting of the commissioners next week. The following week, we get into what I like to think of as the meat and potatoes of our budget season. We really start getting into our budget meetings hard, and there's a lot of requests this year. For some reason, I naively thought it'd be an easy year for us, but there's a lot of requests. There's a lot of needs. The pie can only be cut so many ways. There's only so much to go around. We recognize that, and we're going to really get into it and start working hard on our budget coming up in 2 weeks. Thank you very much. Have a great week. Stay warm and safe.
Thank you, Commissioner. Commissioner O'Connor?
Thank you. Thank you, Mr. President. So, there are a few things. I do notice all the chatter about the spike in crime in the county. I know the sheriff's office is working diligently on that, and the shootings down in the south end of the county. So, I know they're working diligently. We don't get updated by the sheriff's department directly on those cases, but they do their job, and we find out later on that they've closed the cases and people are getting prosecuted, and they do an amazing job at that. So, just wanted to recognize that. We do see it, and we do hear you on it, and the best person to speak to relative to that is the sheriff. Reach out to him, let him know your concerns, and go from there. Secondly, the vaccines. I've been corresponding with, our delegation. I've been corresponding with the Deputy Secretary of Health. I spoke to Commissioner Morgan the other day and called him up and I said, hey, we finally got an answer from Annapolis. And it was the Deputy Secretary of Health who, in my opinion, was misinformed as to the local issues that we're having here. But that seems to be a constant thing coming from Annapolis. When you look at the House and the Senate, they are usually misinformed as to what's going on at the local level. And, it takes us to go ahead and reach out to them and the citizens at the same time and let them know that, hey, look, we know what's going on down here. We're in touch with our citizens. We're the most direct form of government here. And we hope that you would consider what we are saying and what our citizens are saying. That's evident that that's not happening right now with a lot of these bills that were snuck in under the noses of the citizens of this county. We've worked diligently and I would say conservatively in nature with our budget. And, Commissioner Colvin said it best, that there's only a certain amount of money to go around, but yet Delegate Crosby just voted for a $120 million tax increase. I don't understand where the reality comes in on this one, where you think that in this time where people are suffering, a tax increase is the right thing to do. To me, that just does not represent St. Mary's County and what we are looking for and how we are doing and how we are operating. It's very concerning to me. I want people to get vaccinated with the COVID-19. And our local local health department's done an amazing job. And there's no doubt that if you look at the data, if you can get the data from the state, which we're fortunate to be able to get some of it, you can see what's going on with the mass vaccination sites. Dr. Brewster was very kind in how she presented it. I don't have to be. The fact is that when you have, let's just say 1,000 of something, and you've allocated 100 to 10 different locations, and then you create 2 more locations and you need allocations, you're going to take it from the other spot. So supply and demand, it's simple. You have to take it from somewhere to give it somewhere. And we're robbing Peter to pay Paul, and we're putting our population at higher risk because they want to centralize these vaccination facilities. And our most vulnerable population and those that can't commute, we have Amish and Mennonites that want to get vaccinated that, how are they going to get up to Prince George's County? It's an hour-and-a-half drive to Six Flags America from the north end of the county. If you live down in Lexington Park and Ridge, you're talking all day for you. It's an hour and 45 minutes. I've done the drive. Then you're going to sit there and wait for hours and then come back home. And you have to do that 2 times. So that's 2 days of work that you would have to miss. I just really think they're missing the mark on this one. And, I'm extremely upset about it. I hope that the governor is hearing what we're saying, because I truly believe, based on what our governor has said, that our allocations would not have gone down. I believe that the health department and possibly his staff are not giving the true matrix of what is going on based on what their mission is. And in politics, we all fall victim to it at times, and it's called a highlighter. You get the facts that are highlighted, and if you don't take the time to read in between it, then you're going to sit there and you're only going to get what people want you to see. And that's one of the reasons the Vietnam War went on for so long. And that's where I got that from, the highlighter. That president was always presented highlighted notes. So either way, that's a little bit of frustration there, but hopefully we'll get some positive out of it. And, I appreciate it, and keep calling that 800 number. I saw it was posted, and let them know what you think. That's the only way your voices are going to be heard. So thank you.
Thank you. Let me just jump on Commissioner O'Connor's statements on the vaccines. He's right. And I think all the members of our commissioner board are correct. And Dr. Brewster, she's just doing one hell of a great job out there. But you're basically in a boxing match with one hand tied behind your back at the will of whatever Annapolis decides to give you at any one particular time. And Commissioner O'Connor, I haven't discussed this. I'm glad he went up to the Deputy Director of Health and said, what you're doing, you don't have, it's making no sense. So I just want to continue to tell the people out there, we're doing the best we can. Dr. Bruce is doing the best she can. If you got a problem, it's that 475-4200 extension 1049 number to help get us through. As both the other commissioners mentioned, the budget's coming up. Guys, this is round number 11. I got 11 and 12, and it's it. But it's going to be complicated. And it's complicated not just because of everyone's wish lists coming in. And believe me, the wish list is bigger than, as I said, there's no more leaves on the tree out there to grab right now. And it's going to be very complicated how we work through this and figure out to provide allocations for everybody. And I hope to tell you, everyone's dreams and expectations probably aren't going to get met. But at the same time, Commissioner Guy and I are spending an incredible amount of time this year with Annapolis and through MACO. And last night, our 3-hour meeting got canceled because there's just so many bills. So I'm sure tomorrow morning, when we start at 9:30, we're going to be going until 12:30 or 1, going through all these bills. But there's cause and effect. And for actions are consequences. And the actions that are taken in Annapolis are the consequences on us. So we go back to the budget, and our concern is, what are the actions? What are the consequences? We face the consequences. The actions are taken. It's, a lot of stuff sight unseen, just as the testimony this afternoon will be given. Get one person to sit there. There's your Zoom. There's your box. And there's what you got to live with. So we're working this really hard, but our concern at the end of the day is you citizens, what you're asking for, what's required, and what can we feasibly do to make sure that it works for everybody. So that's where we are there. On some lighter notes, we talked about the farmers market. February 13th, flying farmers market out the airport again, sponsored by Southerly and our other retailers. It's a lot of fun. It's not like going down to the Red Barn, which is Saturday mornings, 10 to 1 now at the Red Barn by Gate 3. The flying farmers market is out at the airport on the February 13th, which I think makes, Saturday too? Mm-hmm. So you got 2 farmers markets to choose from, sports fans. So if you want to patronize our local farmers and things like that, great place to go. Snow. I'm from Buffalo. I like the snow, okay? 3 inches, this little dribble we're getting down here, I know it causes a lot of heartache and pain, and nobody here likes snow, but I really don't think it's going to snow, okay? I listen to this aside. Dr. Brewster or Dr. Bridge and I laugh a little every once in a while about the snow, so, I'm betting on 3 to 4 inches max. Other people can bet on more, but, let it snow, let it snow, let it snow. And finally, It's Valentine's Day coming up on Sunday. So I want to wish all the ladies out there happy Valentine's, especially my daughters, my girlfriend, happy Valentine's Day. If it snows, I don't get to see you. If it doesn't snow, I look forward to seeing at least some of you. With that, thanks and have a great time, and we'll see you again in 2 weeks.
Thank you, Doctor. Doctor. Thank you, Mr. Morgan.
You're welcome.
That's very good. My week was sort of complicated this past week. Unfortunately, I had to get some eye surgery done at Johns Hopkins University Hospital in what's called the Wilmer Eye Institute. And it's amazing what they have in our area and the connections that we have for some unbelievable things. Thursday morning, actually, I went up there, and by 1 o'clock, they were cutting open my eye on my right side and actually doing a partial transplant of my cornea. This is probably unknown to many people, but rather than total cornea transplants, they can actually take the tissue that's bad in your eye, remove it, and they're replacing it with a transplant from some donor eye. And I got to admit, I'm not even wearing glasses right now, and I'm sort of blurry in my right eye, but the vision is slowly coming back every day. And it's an amazing surgery, and I'm grateful for my wife who waited for me. She had to drive me up here, and they would not allow her inside the surgery center. She literally sat outside in the car for almost 6 hours. I think she went over to the main hospital for a little bit, but they wouldn't even, they're so restrictive about this COVID thing. You can't even go into the waiting area anymore. You definitely can't go into the surgery center at all. So it's a trying time for all of us here. But I'm mending well, but I spent most of my time after the surgery. I had to lay flat on my back for 2 days because of this. They put a bubble in your eye to hold this tissue in place. It's almost impossible to sew it in place. I mean, it's amazing what they do, but I'm recovering well. So most of that was done there. I got to say, I do thank everybody out there that's been the great volunteers during our vaccination clinics here and everything. It's been tremendous. My wife and I worked a couple Thursdays ago, and I was amazed at all the people that were there and how dedicated they were and how quickly they were moving these vehicles through the Hollywood Fire Department Center. Like everybody said here, and you heard the testimony from Dr. Brewster, it's not nothing to do with the way we can administer it. It's just the availability of the vaccine. Now, I will say, I did tell my brother, I got a younger brother, believe it or not, I got 5 younger brothers. This was one of the younger ones, 69 years old. But anyway, he complained about not being able to get on, and I said, hey, call the health department. Call the Aging and Human Services Department. I gave him the number, 301-475-4200, 1049. He did. And of course, the next week he got on. So for those of you 65 and older, please do use that number. And they are using that list to get to us that are in the aging population. So I say, please sign up. Remember, extension 1049. It's easier process than going online, believe it or not. So with that said,
Mr. President,
yes,
I want one more thing out there, sports fans. Bipartisanship and working together. For a number of months, the county has been working hard on getting FEMA money back for Hurricane Isaias. And if you remember, 2 times we had a lost, and we had to go back and to appeal that decision, and it's been dragging. So Congressman Hoyer and I have been in touch a lot on this stuff. 2 things: getting the money back to the county for FEMA for the Isaias, and getting the Route 6 bridge up at Persimmon Creek repaired. This week, he called me, and his staff called me earlier in the week to let us know that FEMA has approved the redistribution of money. So it's not, when we come back to the budget, we have to find $1.2, $1.4 million along the way out of our budget to pay for the damages, but FEMA's going to reimburse us. So, in the game of politics is local, and I know there's a lot of angst out there with everything going on in D.C., but I want to thank Gerald Gardner, Steve Walker, and Congressman Hoyer for helping get us the money back here for FEMA and making sure that, our budget gets refreshed along the way. And so there is still some bipartisanship out there. So with that, thank you, Mr. President.
Thank you. That is very good. And it's a lot of hard work on everybody's parts. There's a lot of behind-the-scenes things that go on, not just in the local county here, but we go outside the county as much as possible to help. And so we appreciate those who are following. Commissioner Morgan and I work a lot with Annapolis through MACO and the Rural County Coalition in trying to follow these bills that, in the end, we try to get no more unfunded mandates passed on down to the county. But unfortunately, I think we're going to have a lot of them to pass down this year. With that said, I need to have a recommendation to go into closed session.
I move to enter into closed session to discuss real property.
Second.
Our first and second, all in favor?
Aye.
And I'd like to have about a 5-minute recess. Is that okay with everybody? Sure. Okay, we'll reconvene there at 7:45.